and key groups, including the women, the youth, and the economically vulnerable. Before we get the ball rolling, I would like to give a shout out to Mind You for putting this beautiful event together. So make sure to follow them on their social media accounts at MindYouMHS on their Facebook, Twitter, Instagram, and Kumu. Of course, don't forget to add in the hashtags and the stigma and hashtag National Mental Health Summit 2021, when you post about the event. And then we will also be entertaining some questions from the audience later for our panel discussion, so do watch out for that. Of course, a special thank you to our sponsors, Araneta City, J. Amado Araneta Foundation, Novotel Hotel and Resorts, Finma Properties, Security Bank, and Spark Philippines for making this event possible. To start us off is Mind U's very own senior psychologist here to talk about the impact of stigma on mental health. Let's welcome to the stage Ms. Reyes Celine Villa.
Good morning. You know, we've been through a lot. The past year and a half has changed the world drastically, and our lives are not the same as they were when the pandemic started. We've all had to adjust to new routines, new setup. Hence, this is the new normal. And although some of us may be somewhat okay now, the truth is that collectively, we're not that okay. No one was prepared for just how much the COVID-19 pandemic would upend life as we knew it. A year before the pandemic, the Department of Health reported that around 3.3 million Filipinos have depression. And this year, that number ballooned to 17 million, a whopping 415% increase in just a year and a half. And these numbers may be the tip of the iceberg due to underreporting and the stigma attached to seeking professional help. You know, the pandemic has not been kind. We have suffered through isolation and loneliness, and the feeling of hopelessness has seemingly become unescapable. Sadness, anxiety, depression, and stress levels are at an all-time high. For some people, the chaos of the pandemic has served as a trigger for the appearance of their own mental health conditions. But you know, despite all of this, why are some people still afraid of speaking out, even if they're already silently battling serious mental health conditions? Some of it has to do with our culture and how it perpetuates stigma among those with mental illness. The prevailing viewpoint on mental health in this country is that it's something to be ashamed of. The stigma of having mental illness perpetuates the notion that having these conditions is a personal failure, that it's kind of a burden to be carried and something never to be talked about. When other people say, "Oh, do you know that this person's crazy? Baliw? She's insane? Mood swings, parang bipolar lang. She has this kind of condition." They place the burden of society's disapproval and disdain on those who are suffering. And stereotypes prevail. People with mental health conditions are considered what? Unreliable, unstable, and some even dangerous. This judgment makes it hard for those who are experiencing mental distress to acknowledge that yes, there is a problem. You know, around 40% of people diagnosed with serious mental health conditions never seek help or never finish treatment. The stigma that society perpetuates finds its way into us as well. And we become ashamed about something that we cannot control. We judge ourselves. We subject ourselves to accepting the blame that society puts on us. And as a result, this leads to more adverse health outcomes. People who do not seek help often are at risk for their conditions getting worse. And this gradual decline will often seep into other aspects of their lives as well. May it be their family, their declining performance at school, or at work. At worst, the pain and the stigma are enough for some people to even consider ending their lives. It's important to acknowledge that there are also institutional barriers to mental health care as well, which limit the access and implementation of the Mental Health Act approved only a few years ago. At present, there's an allocation of 615 million pesos for the National Mental Health Program. Looks sufficient, but when you divide all of it, this would only result to 5.69 pesos per capita. And how is that possible? Another challenge is that there are only 1,451 registered psychologists. That gives us a ratio of 1 psychologist per 100,000 Filipinos. Now imagine, would you be able to care for 100,000 people alone? There is a dearth of qualified professionals to handle our mental health crisis. The lack of access to services and the high cost of attaining quality care is a contributing factor to the state of mental health care in our country. You know, things need to change, and overcoming this great risk involves multiple factors at multiple societal levels. As mental health practitioners, our greatest contribution to easing stigma is education, both for ourselves as well as for the public. Educating ourselves on the root causes of the stigma can inform our interventions and our attitudes. Psychoeducating the public can help change the way one views mental illness to hopefully destigmatize the stereotypes that arise. Social media is another avenue that can both create stigma and foster acceptance and understanding. In recent years, there's been a greater sense of acceptance of mental illness, in fairness, especially among the youth. All right? So with people opening up themselves with friends about their struggles. And the use of social media allows for an ease of access to mental health resources and acts as a coping mechanism. Changing the prevailing negative attitudes towards mental health on social media to make it, more explanatory and supportive can educate those in need that they are not alone and the burden is not solely theirs to carry. In the broader community, it aims to foster perspectives that mental health is not something to be ashamed of, but something we can collectively overcome together by creating a supportive, nurturing environment for those around us. Perhaps our collective experience of the emotional and psychological problems brought about the COVID-19 pandemic can help foster not only awareness, but encourage compassion and empathy as well. We Filipinos, we take pride in putting each other first before ourselves, or what we call pakikipagkapwa. In light of this, we have to move together and support those of us who suffer silently. Support those who are afraid to speak up. But it's also about time to take care of ourselves too. We can't give what we don't have. And as mental health practitioners, we also have to practice those things. We should also acknowledge that there are times, it's okay not to be okay. And by doing so, we can enact change. We change our outlook. We change our community's perspectives. And eventually, we can bring about systemic change to improve the Filipinos' lives for the better. Today's National Mental Health Summit aims to do just that. Through education, we can broaden our perspectives and hopefully make the future brighter. There will be no need to look for that silver lining if you can already see the sun shining. Good morning, everyone, and have a great day.
Wow, that's wonderful. Our next speaker is known for her tireless work in promoting public health, women's rights, and the welfare of the Filipino family. She is also the author of the country's mental health law. For today's summit, she sent in a video where she will be talking about the history of mental health in the Philippines and how the Mental Health Act came about. Let's hear it from Senator Risa Hontiveros.
Magandang araw sa inyong lahat. I hope you're all safe and healthy in all ways wherever you are.
Magandang araw
We're
sa
all
inyong
doing
lahat.
our best to
I hope
get
you're all
by.
safe
Hindi kayo
and healthy in
nag-iisa.
all ways.
A heartfelt
wherever you
thank
are.
you
We're
to
all
Mind
doing
You
our
Mental
best to
Health
get
Systems
by.
Inc.
Hindi kayo
for putting
nag-iisa.
together this national
A
summit
heartfelt
that
thank
puts
you
mental
to
health
Mind You
front
Mental
and
Health
center
Systems
again.
Inc. for putting
Thank
together
you to
this
all my
national
fellow
summit
advocates
that
present here
puts
today
mental health
for
front
always
and
showing
center
up for
again.
Filipinos' mental
Thank
health
you
in
to
the
all my
ways you
fellow
can.
advocates present.
Summits like this also give policymakers like me time to reflect and learn. Many of us here had been following the story of the mental health bill for decades. When I entered the Senate in 2016, it was one of the bills I made sure to author and file in the 17th Congress. In 2018, we won our biggest victory. We finally, against all odds, against centuries of taboos and cultural misconceptions, got to pass the bill into law, our first Mental Health Act. But really, that was only the beginning. Mental health is more than obvious wellness like fitness, yoga, or skincare. Not to say at all that these aren't important. With our different stories, some of these might be life-saving for some of you. For me, personally, I try to do yoga in the evening or early morning, and it has been very helpful for me physically and mentally. But that is just part of a whole worldview. Our systems and cultures have created processes that oppress, hurt, and stifle our human rights. Proper livelihood, universal health care, and quality education have become impossible for many people to attain. And what is the consequence of all of this? Rising numbers of mental illnesses like depression and anxiety, and even cases of suicide. Mental health is a life issue. It is a community issue. We need to strengthen the enforcement of the mental health law now more than ever. Last year, we flagged the alarmingly low budget allocation for mental health-related medicines. Mental health medication are one of the most expensive maintenance drugs. There must be a way to subsidize these medicines and services. There should also be service capability upgrading for local mental health facilities in order to keep up with the evolving needs, especially at this time when addressing mental health concerns is as critical as any physical health intervention. Prioritizing mental health takes a lot of systemic and cultural reworking. Seeking real professional help, for example, shouldn't be so hard. Integrating mental health into our culture and eradicating stigma should be part of our collective responsibility. There is no mental health without social justice. Basic needs and rights must be attainable and non-negotiable so that anyone can pursue a kinder life. Imagine a society that permits everyone, no matter our social class or SOGI, to rest our bodies and minds. A gentler society is possible. My friends, let us make it easier to look out for one another. Again, maraming salamat sa lahat.
Wonderful talk, Senator Risa Hontiveros. Now let's get to our third speaker for today's summit as we drill down on the national state of mental health. Joining us today is Ms. Susan Sabado from the National Center for Mental Health, which is an organization dedicated to delivering preventive, curative, and rehabilitative mental health care services. Let's welcome her to the stage, everyone.
Good morning. Thank you to Mind You for the invitation. So to start with my lecture, so good day to all. I am here now as a mental health professional with the aim to impart to you several important points with regards to the current status of mental health in the Philippines, as well as the mental health services available to the public. I will specifically share with you the mental health programs offered by the institution I am currently connected with, the National Center for Mental Health. So first, let us take a look at the status of the mental health in the Philippines before the COVID-19 pandemic began. So mental health is defined by the World Health Organization as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Globally, conditions affecting mental health are constantly growing concern. The WHO has even predicted that by the year 2030, 13% of the world's diseases will be mental disorders. In 2017, the World Health Organization reported that almost 3.3 million Filipinos suffered from depressive disorders, which is the fourth leading cause of disease burden. These disorders involve feeling of sadness, low self-worth, a loss of pleasure interest, and disturbed sleep or appetite, among others. As a result of these debilitating symptoms, depression places what is known as a health loss or disease burden in those who have this condition. In other words, a person's quality of life can be diminished greatly by depression. Moreover, according to the same WHO report, over 3 million Filipinos struggled with anxiety disorder in 2017. A 2018 report by the DOH has also showed that in the Philippines, an estimated 1 million individuals suffer from schizophrenia, 15.3 million from substance use disorders, and 877,000 die as a result of suicide every year. The present pandemic has made the threat of mental disorders even more imminent. The crisis hotline of the National Center for Mental Health, which provides 24/7 assistance to those calling with regards to mental health concerns, has reported a steady increase in the number of calls they have received since the pandemic started in early 2020. From a daily average of 13 to 15 calls in May 2019, to February 2020, the crisis hotline received around double that number, a daily average of 30 to 35 calls on an average daily from March to May 2020. The restrictions with regards to limiting physical contact and interaction, restricting travel across borders, and even closed down malls and shops have all prohibited people of all ages from engaging in activities that they usually did as part of relieving stress and taking care of their mental health. The sudden change from freely enjoying life outdoors to facing the threat of an invisible enemy, the coronavirus, has taken a toll on everyone and challenged us all to figure out ways to live in the new normal without sacrificing on our mental health. Secondly, let us explore the calls received by the mental health or suicide hotlines. Republic Act 11036, more commonly known as the Mental Health Act, has actually specified that mental health agencies set up or strengthen 24/7 hotlines providing assistance to people with mental health conditions, especially those at risk for suicide. There ought to be mechanism for the prevention of suicide as well as interventions and response strategies with emphasis on concerns of the youth. As I have mentioned earlier, here in NCMH, we offer a crisis hotline staffed with trained crisis responders as well as mental health professionals. The hotline is available 24 hours a day, 7 days a week, offering free assistance to those who are in crisis and at risk of suicide. Last month alone, September, our hotline received 2,272 calls, of which 841 were suicide-related. 208 of the said total calls were from minors aged 18 years and below. With regards to gender, 63% of the total calls were made by females, while 37% were made by males. In addition to suicide and crisis situations, our crisis hotlines also receive other concerns related to mental health. For instance, to report anxiety and depressive symptoms. Others called with regard to physical, verbal, or sexual abuse, which are of course likely to aggravate or bring about other mental health predicaments. Some callers reported family problems, while others verbalized academic or school-related concerns. All these stressors can trigger one to experience symptoms of emotional or mental distress, which can be confusing or frightening to someone to have to deal with alone. Aside from its services for the general public, our crisis hotline also offers free online psychosocial support sessions for our healthcare workers every Monday to Friday, 8 a.m. to 4 p.m. As we know, this pandemic has placed additional workload and immense responsibility on our healthcare providers as they are in the front lines of battling COVID-19. At the same time, they themselves are likely to struggle with anxiety or fear related to contracting the disease themselves and possibly passing them on to their household members. Furthermore, our healthcare workers have endured discrimination which aggravates the physical and psychological strain that they are already dealing with from working long shifts in a thankless job. Repatriated Filipinos are also among the populations catered with free online psychosocial support by our crisis hotline. As a result of the ongoing pandemic continuing to close down businesses and lay off employees, many of our fellow Filipinos have been forced to go back to our country without a job to support their families and an uncertain future ahead of them. They need to be supported not only materially through cash aid by other agencies, but also by adequate psychosocial support to assist them in strengthening their mental health through this trying time. The NCMH Crisis Hotline could be reached at the numbers as shown there. So aside from running a crisis hotline, NCMH also provides a multitude of other programs and initiatives centered at providing mental health care to the Filipino public. In emergency situations in which someone needs urgent psychiatric care, for instance, someone suspected of having mental health problems may be a danger to himself or others, our psychiatric emergency room is open 24/7 to manage such crucial cases. Should the patients be assessed to need further treatment within the hospital, then our admission section will accommodate the patient as needed. Mental health care, however, not only centers on caring for those who need admission and psychiatric care in a mental health facility. It also involves offering outpatient services to respond to the needs of a wider population. For instance, in NSMH, we have outpatient services for adult as well as our child and adolescent patients. Normally, these services include our patients visiting the hospital at set intervals for face-to-face consultations with a psychiatrist in order to diagnose and then treat their condition on an outpatient basis. Because of the restrictions necessitated by the current pandemic, the outpatient adult section has also recently set up online consultation services. New patients seeking care at NSM8 can consult with a psychiatrist through e-consultation, while those who are already current patients of NSMH can avail of teleconsultation or e-pres for electronic prescription and ROM refill of medication. These services allow those with mental health needs to receive psychiatric care that they need, even with the current limitations on physical interactions. The need of our patients do not stop even with the pandemic going on. So we also need to be responsive according to what the situation requires. For instance, their prescribed medications need to be consistent in order to be effective, and regular consultations are needed to ensure that their treatment matches their current needs. So teleconsultation and electronic prescription services are important adjuncts to our patients' current management. In addition to our outpatient sections for adult, child, and adolescent, we also have the Women and the Children Protection Unit, or WCPU, and the Forensic Psychiatry section. This WCPU serves as a specific demographic, women and children who have suffered sexual and psychological abuse. The WCPU provides assessment, diagnosis, and management as needed to help these women and children. On the other hand, our Forensic Psychiatry section caters to the mental health management needs of individuals with judicial court cases. For instance, this individual's capacity to stand trial is assessed by our psychiatrists and psychologists as ordered by the court. Another initiative of the NSMH is what is known as the MHPSS, which stands for Mental Health and Psychosocial Support Services. As its name suggests, the MHPSS is a team of mental health workers and professionals who are trained to provide services that support mental health and offer psychosocial aid to areas and populations in need. For instance, an MHPSS team may be deployed to provide psychological first aid, or PFA, to evacuated residents of an area that was recently affected by natural disasters such as typhoons, floods, earthquakes, and volcanic eruptions. During this pandemic, the MHPSS team is also called on by other government agencies to provide services for locally stranded individuals, returning overseas Filipino workers, and other frontliners from private and public agencies. So far, 414 referrals have been received and consequently addressed by our MHPSS team for that purpose. Moreover, with NSMH being a specialty research and training hospital, we also provide technical assistance to other government or public agencies as well as to private institutions. We offer online lectures, fora, and webinars that disseminate information about mental health, as well as assistance in promoting workplace and school wellness. Moreover, with the recent establishment of the Mental Health Act, there is an even greater need for trained mental health care workers to staff our barangay mental health units. For this reason, the NSMH continues to offer capacity building and training for primary healthcare workers and other healthcare providers. In summary, there is a wide range of programs and services available in our mental health facilities and centers. These services are offered not only for individuals who need psychiatric care sheltered within the hospital, But just as importantly, mental health services are for everyone. If you are mentally healthy at present, there are webinars you can join or resources you can tap that offer psychoeducation, which can help you continue to stay healthy and gain strategies that will strengthen your coping mechanisms even more. If you are someone you know is facing a problem or stressor that is starting to negatively affect the way they feel, think, and function in different areas of life, then maybe it would help to start talking to a counselor. If you're experiencing symptoms such as intense sadness that lasts for weeks, thoughts of suicide, or debilitating anxiety that impairs your ability to live a normal life, then it's time to seek the help of a mental health professional. Or if you notice someone else starting to isolate themselves from people more often than usual, maybe have cut marks on their forearm, or talk about going away forever, try to offer emotional support without judging their feelings. Perhaps recommend suitable mental health services that could be accessed by this person. Even as we have seen progress in the mental health field in the recent years, there still remains a wide-reaching stigma attached to having mental health problems or even seeking a counselor, a psychologist, or a psychiatrist. However, let us all bear in mind that seeking the aid of mental health professionals is not just about helping those with mental health disorders. It is also for everyone. Engaging in activities that promote your mental health, be it by seeking psychoeducation or seeing a counselor or psychologist, can help you achieve the best version of yourself while managing the pressures that come with the process. It can aid you in creating and nurturing healthy relationships in your personal life. It can also assist you in applying strategies that will allow you to go through challenging parts of your life in a healthy, adaptive manner. So instead of perpetuating stigma and discrimination with regard to mental health problems, let us all be instruments of an inclusive, supportive community as we promote mental health in ourselves and in those around us. Thank you and have a good day.
Okay, it's been quite a jam-packed morning. So let me introduce to you our next speaker for today. She is a staunch advocate for workers' mental health and women empowerment. She is also the president of Mageo Consulting, Inc., which is a company providing business advisory and corporate finance services. She will be talking about women's impact on the economy and the role they play in maintaining the mental health of the family through a video. Let's hear it from Ms. Maria Aurora Geotina-Garcia.
Good morning to all. Allow me to recognize our distinguished guests and participants. His Excellency Stephen J. Robinson, AO, Australian Ambassador to the Philippines. Good morning to all. Senator Risa Hontiveros, Chair of the Senate Committee on Women, Children, and Family Relations. Mayor Joy Belmonte of Quezon City. Cheryll Lat-Agsaoay, Vice President, HR Head of SM Supermalls. Francis Cuevas, Chief Health Program Officer of the Department of Health. Dr. Dinah Palmera Nadera, Medical Specialist and Project Leader, UP Diliman. Dr. Karen Trinidad, Sports Psychologist, Philippine Sports Commission. Catriona Gray, Mental Health Advocate and Miss Universe 2018. Francesca Taruc, Mental Health Advocate and Binibining Pilipinas candidate. Yasi Pressman, Mental Health Advocate and actress. Event organizers and sponsors, Spark Philippines, Mind You, J. Araneta Foundation, Finma Properties, Security Bank, Araneta City, and Novotel Hotels and Resorts. Mental health is one of the neglected areas of health, and several reasons emerge as to why mental health has been ignored. Its association with stigma comes first, and the perception that it's all in your head comes second, because people can't notice it right away. Sadly, statistics on mental health show an increasing trend. The World Health Organization, or WHO, reports that nearly 1 billion people live with a mental disorder. In developing countries, more than 75% with the disorder are untreated. Every year, close to 1 million people die due to substance abuse. Every 40 seconds, a person dies by suicide, and these rates can double during crisis. In addition, WHO estimates that the global economy throws away $1 trillion per year from productivity loss caused by anxiety and depression. WHO also reports that women are twice likely to experience anxiety, and more women than men experience depression. In the case of the Philippines, according to the National Statistics Office, or NSO, our country has no more than 700 practicing psychiatrists versus our almost 107 million population. Or to put it more simply, the country has one psychiatrist for every 152,000 Filipinos. On top of that, we have been hammered by one of Asia's worst COVID-19 outbreaks, with more than 2 million COVID-19 cases and an average of 20,000 cases per day, and recovery could take longer than previously expected. While the demand and need for mental health services is increasing, a fragmented and outdated model and lagging policy changes, as well as shortage of human resources, are key challenges that we face every single day. The COVID-19 pandemic brought great economic strain to countless families in various countries. It continues to challenge homes with heightened vulnerability, such as those with women who disproportionately share the burden of unpaid care work. Many families currently need to raise and educate their children without institutional support, which is reducing remunerated working hours and increasing stress. Social isolation and the general fear of uncertainty have affected mental health in the Philippines. In a survey commissioned by the Philippine Business Coalition for Women Empowerment, PBCW, and Investing in Women, first in May and later in December 2020, over half of workers reported worse mental well-being, and 50% of workers reported worse physical well-being, both increasing compared to the May 2020 survey. Anxiety about the situation, financial and family concerns remain the top reasons for the negative impact on mental well-being. Balancing work and family tensions have increased as sources of mental distress as the pandemic has dragged on. Older workers reported more resilient mental and physical health than younger employees. Exhaustion due to increased domestic burdens increased significantly as a cause of physical distress, particularly for women. Inability to exercise also increased as a cause of physical distress. As the survey data does not include informal workers or those who have lost their jobs, it seems likely that the health of the Filipino workforce has been affected to an even greater extent. Women and men are affected in different ways by the pandemic and in varying degrees. Research suggests that the crisis, along with the shutdown response, have resulted in a dramatic increase in the disproportionate burden of unpaid care work on women. Unpaid care and domestic work sustain families and communities on a day-to-day basis and from one generation to the next, and makes a significant contribution to economic development by nurturing people who are fit, productive, and capable of learning and creativity. Yet it remains invisible, undervalued, and neglected in economic and social policy making. And its distribution is grossly imbalanced. Globally, women do 3 times as much unpaid care and domestic work as men. The worth of unpaid care work performed by women is in the trillions of pesos, as what the Philippine Institute for Development Studies noted in their study released in 2019. They said the monetary value of the time women spend doing housework, from caring for children and the elderly to cleaning, cooking, and washing, can make up about 20% of the country's gross domestic product, or GDP. Needs accounted for paid work of men and women. 9.3 trillion, while unpaid work was at about 2.5 trillion, with women contributing 40% for paid work and 76% for unpaid work. The fact that we can convert these time units and chores into monetary units means that there is value in housework. Yet the unpaid care work is radically undervalued and taken for granted. Oxfam's recent findings on unpaid care and domestic work show that women are twice as much more likely to shoulder household tasks, which are compounded by expectations that women are the primary carers for the sick or for those under quarantine in the absence of enough medical services and social safety nets. The notion that women are perceived to be care provider has something to do with the entrenched cultural ideas about gender roles. According to Columbia University professor Dr. Naomi Torres Maki, a sense of role strain among women who are tasked with balancing many roles at once can lead to higher levels of stress. These expectations put pressure on women, leading to exacerbated mental and physical conditions. Women end up being overly exhausted across roles, and it's time to break these stereotypes. Allow me to tell you more about our work on workplace gender equality and women's economic empowerment advocacies. We believe that the private sector has a huge role to play, not only to say that they will create flexible and viable conditions for women to come back for stepping off the career track if they have to. The Philippine Business Coalition for Women Empowerment, or PBCW, was launched in 2017 through a partnership between the Philippine Women's Economic Network, or PhilWen, where Spark Philippines, which I'm representing today, is a member organization, and Investing in Women, an initiative of the Australian government. From 7 founding members, we eventually grew to 18 member companies who are all large employers and leaders of different industries, ranging from retail, real estate, BPO, shipping, direct selling, professional services, insurance, banking, advertising, a holding company, technology, brokerage, and telecommunications. We are also looking forward to welcome a couple more members in the next few months. We work with influential businesses to set an example and a trend to influence their peers and suppliers to attract and retain the best talent. The coalition members believe that this is the way to go. As a result, the coalition has put forward practical and grounded solutions. In relation to mental health, there should be sufficient attention given to examine employees' needs. Companies should be aware of the range of stressors affecting workers, especially their mental health, and those resulting from their increased responsibilities at home. One of PBCW's member companies, the Philippine National Bank, or PNB, has initiated a variety of mental health-related programs to help employees cope with increased stress and anxiety, including helplines and hotlines, webinars, and consultations. This initiative has been featured in PBCW's Workplace Gender Equality case study entitled Investing Wellness in the Workplace. The summary and full report can be uploaded or downloaded on PBCW's website. Companies can also provide relevant, targeted support, including flexible work arrangements, full and partial paid leave, child care, technical support to work at home, mental health and stress services, job training, and reskilling. Evidently, not only is the pandemic worsening economic issues, but also gender issues. Therefore, it is crucial that the strategy for leading our families should encompass reinventing gender roles and confronting the existing gender norms and expectations in the household. In employing gender equality concepts and influencing gender norms, collaboration among family members are better secured. Speaking of employee wellness, one of the male champions of change Philippines founding members, Shell Philippines, implements the Be Well program that aims to help employees to adopt good habits and a healthy lifestyle. This includes food options in the Eat Well program, regular physical activity, move more, smoking cessation support, breathe well, fatigue risk mitigation, sleep well, and resilience, think well. Such programs has promoted a culture where health-seeking behavior among employees is normalized, leading to a happy and healthy workforce. In addition, PBCW is offering the Family Leadership Program, originally conceptualized by Doris Magsaysay Ho of Magsaysay Group, one of PBCW's founding members, which envisions women and men growing within organizations, leading and championing culture change both at work and at home. This module aims to catalyze cultural transformations with vision-driven leadership for home and family, teaching and equipping professionals how to create empathic and supportive family teams unshackled by harmful gender stereotypes, boosted by principles of inclusion and diversity. It also aims to help breadwinners engage the rest of their family in crafting and implementing a family vision and strategy, and to ensure that household responsibilities are evenly distributed based on the family members' competencies rather than stereotypical gender roles. The question now is, what is really happening? In the beginning, people told us that we are all riding the same boat. But the real score is we are all in the same ocean, but we are not in the same boat. Sailing the same ocean, but riding different boats. This is where empathy, camaraderie, and all the intrinsic values of Filipinos will come in handy. This sad reality is that COVID-19 is here to stay. Post-COVID scenarios require a paradigm shift, a redefinition of workplace, and an adjustment to work processes. As the workforce continues to scramble in the middle of a blurry line that separates work and personal space in the home setting, it is vital, now more than ever, that leaders both in the public and private sector create and design coping responses to encompass mental wellness. It is essential for employers to stay in close contact with employees, to support them and the broader business. To close, we call on sufficient attention to examine the unique needs of both men and women. It is important to contribute to women's economic empowerment by positively shifting attitudes towards women at work and home. Because mental health is not as visible as other health dimensions, it is essential to educate and destigmatize the environment both at work and at home. Having approaches in place to promote gender equality and diversity and inclusion can help strengthen our workplaces and foster enhanced well-being for all genders, men and women alike. Thank you and good day to all.
How are we all doing so far? Are we good? Okay, nice. It's just been an hour into the event and we're already learning a lot. I know I did. Do you agree? Yes? Nice. But we're just getting started. We still have lots more to unpack and uncover for the National Mental Health Summit 2021. But first, just some short reminders. Again, make sure to follow Mind You on their social media accounts at Mind You MHS on their Facebook, Twitter, Instagram, and Kumu. If you have some learnings you want to share or you just want to let everyone know that you're enjoying the event, don't forget to add the hashtags and the stigma and hashtag National Mental Health Summit 2021 when you post online. So before we continue, we will be having a 15-minute break so you can reflect, do some stretching, or head to the restroom. Thank you. how are we all doing so far? Are we still good, everyone? Nice. So it's just been an hour into the event, and we're already learning a lot. I know I am. How about you guys? Yes? Okay. So, we still have lots more to unpack and uncover for the National Mental Health Summit. Okay, so welcome back, everyone. Our next guest is currently holding office as the mayor of Quezon City, where she was awarded as one of the top 10 outstanding mayors of the Philippines by the Gawad Filipino Awards. Today, she will be talking about the link between COVID-19, mental health, and its impact on LGUs. Let's give a warm round of applause to Mayor Joy Belmonte.
Thank you, Cristine. I don't know if you remember, but you were an actress in one of the
Yes.
movies in the Quezon City International Film Festival.
Yes, I remember.
Untrue.
Yes.
Yeah. So we met there.
Yes,
Nice
we
to
did.
see you
We
again.
did. Nice to see you again.
So good morning to everyone, to all the participants of today's summit. I'm honored by the opportunity to address you today and grateful that local governments have been included in the discourse about COVID-19 and mental health. COVID-19 has had a great impact on the lives of every individual in our city. While the physical symptoms of the disease have been thoroughly discussed and are very familiar to all of us, not much has been said about how our mental and psychological well-being has been ravaged by the disease. Ironically, I do believe those who have suffered depression, anxiety, and stress due to COVID-19 and our response to it greatly outnumber those who have caught the virus. A cursory examination of the literature supports this assertion. A news article written in April of this year, which I just randomly came across, reports that as per the National Center for Mental Health, the number of distress callers to their hotline doubled just after the pandemic started. The increase became fivefold by the third quarter of 2020 and peaked in March of this year. Had this article been written more recently, it can be surmised that this number would have been even higher. I understand that in an earlier discussion with the Department of Health, they presented numbers that are really showing the exponential increase in the number of persons needing mental health interventions. Among the stressors associated with the pandemic are fear of catching the disease, bereavement, loss of incomes, social and physical isolation, disruption of academic and work routines, food insecurity, restricted mobility and helplessness, discrimination, domestic abuse and violence, uncertainty about the future, the list goes on and on. Local governments were and continue to be at the forefront of the COVID-19 response. While I, as a local chief executive, was always called to Zoom meetings to discuss IATF quarantine categories and other IATF protocols regarding testing, contact tracing, isolation facilities, vaccination, and hospital care utilization rates, I cannot recall any meeting, online or face-to-face, to discuss the issue of COVID-related mental health problems, whether of those who have acquired the disease or of those living in and adjusting to a pandemic environment. Therefore, the role of local governments in helping constituents cope with the mental health effects of COVID-19 cannot be emphasized enough. In this regard, we were pretty much left to our own devices. Judging from my own experience on the ground, 5 sectors seem to have borne the brunt of COVID-19's repercussions on mental health: women, minors, the elderly, frontliners, and COVID-19 patients and survivors. Data from around the globe reveal that women experience greater mental and psychological stress as compared to men because of having to juggle working from home with childcare and other unpaid work. These include doing household chores, tutoring school-aged children, and taking care of the elderly. This stress is exacerbated by worrying about the well-being of the family, especially in the event of job loss and financial burdens. To some extent, I believe the national and local government's cash assistance program and the city's various food distribution and livelihood generation programs, as well as its educational assistance program in the form of gadgets, internet connectivity, and school supplies for pupils, alleviated some, but by no means all, these stressors for women. One program we established that appears to have had a positive effect, mostly on women and the elderly, is urban farming. Scientific journals often cite gardening as being able to reduce stress, anxiety, and even depression, at the same time boosting confidence and self-esteem. Vegetable gardening is also a means for us to address food insecurity in many of our urban poor communities. To date, we have distributed more than 53,000 seed starter kits for free to individuals and communities who want to avail of urban farming's therapeutic or hunger mitigation outcomes. To add to the already difficult circumstances many women faced because of the pandemic, local data demonstrate that domestic violence and abuse increased by 66% from 2020 to 2021 due to tension at home intensified by factors such as job loss, restricted mobility, and cramped living quarters. These reports were disturbing to me, and although NCR was under ECQ, we decided to open up again our Protection Center for Gender-Based Violence and Abuse, and later establish a temporary shelter called Bahay Kanlungan for those who were forced to flee their oppressive households. Maria, for example, is a 21-year-old senior high school student from Barangay Bagong, Silangan, and the youngest of 5 children. In March of this year, she left home in the middle of ECQ to escape the constant sexual abuse she experienced in the hands of her father and brother throughout the pandemic. While at the shelter, Maria manifested behavioral problems and started hallucinating and attempting suicide. She also developed paranoia and suffered from insomnia and dramatic mood swings. She was later diagnosed as a schizophrenic at the Philippine General Hospital Psychiatric Unit. At present, she is under medication and gathering up the courage to file charges against her perpetrators. Maria is just one of 63 victims of violence and abuse assisted by our Protection Center during the pandemic. Children are also among the vulnerable sectors most affected by the lockdown. During the celebration of Children's Month last November 2020, the city conducted a Kumustahan sa Batang QC survey to determine the state of our city's children. Many of them admitted to feeling depressed and anxious, primarily because parents had lost their sources of income, and secondarily because of difficulty adjusting to online learning. Marco is one such child. Prior to the suspension of face-to-face classes, this junior high school student was an overachiever. With the shift to distance learning, however, Marco's teachers noticed a sudden change in his disposition. He no longer participated during online classes and, in fact, often skipped them. According to his parents, he became highly introverted and spent his days playing mobile games instead of joining family activities. Consultation with a guidance counselor revealed that Marco had adjusted poorly to online learning. This caused him to become socially distant, impolite, and impatient. He had also become a victim of cyberbullying, which affected his self-esteem. Today, Marco has shifted to a modular learning platform and continues to see his guidance counselor. Unfortunately, the Department of Education has very few guidance counselors to see to the mental health needs of public school students due to the mismatch between the level of competency required of a guidance counselor and the salary rate that is available to them. In Quezon City, there are only 20 guidance counselors catering to the needs of over 400,000 school children. To address this issue, the local government will be augmenting the salaries of at least one guidance counselor to be hired by the Department of Education for each of our 158 public schools. To further relieve children of the negative effects of immobility, Quezon City passed an ordinance creating child-friendly safe zones. This ordinance establishes criteria that allows certain open spaces, such as parks or playgrounds, to be designated safe for children, where they can play and socialize with other kids with little risk of COVID-19 transmission. The ordinance was only implemented for 1 week because it was suspended due to the imposition of ECQ last March. This week, however, given the shift to the less restrictive Alert Level 3, we will be allowing children on limited capacity into the Quezon Memorial Circle. And hopefully, if the alert level goes lower to Alert Level 2 or even 1, as is predicted by experts, then our children will be finally allowed out of their homes. The elderly are perhaps the most vulnerable to the threat of COVID-19, because of which they are strictly prohibited from leaving their homes. This sudden disruption to their daily routine, minimal contact with friends and loved ones, and lessened access to medication and care have caused anxiety among many of them. Lola Pinang's case is a noteworthy example. This 65-year-old widow had retired healthcare worker lives alone and copes well with the disability of having a prosthetic leg. When the ECQ was imposed, she was stranded in the province where she was overseeing the construction of her retirement home. The isolation caused her to feel distressed, depressed, and helpless. She was afraid to go out and afraid to go to sleep. Coincidentally, she learned about the free online consultation program of the Quezon City General Hospital Department of Psychiatry over the radio. She decided to avail of this telehealth program and was prescribed treatment and therapy. Since she was unable to leave her house, the Quezon City General Hospital coordinated with our pharmaceutical representatives to deliver medications directly to her home. And she is now at the tail end of her therapy, depression-free. The Quezon City General Hospital is one of 3 local government hospitals in Quezon City that assesses and treats mental health disorders. Since the pandemic began, it has provided online therapy sessions through its Department of Psychiatry. The number of psychiatric patients treated by the hospital rose by 12.5% from 2019 to 2020. The top 3 mental illnesses recorded are schizophrenia, major depressive disorder, and bipolarism. Among the elderly, anxiety due to fear of COVID infection remains among the 3 main causes of their mental illnesses. By far, the most at risk are our frontliners, most particularly our health workers. In addition to having experienced discrimination during the early days of the pandemic, the very nature of their work prevents them from seeing their families for months, which could only have caused severe distress and anxiety among them at the very least. After receiving countless reports of health workers being thrown out of their rented apartments and rooms, as well as COVID survivors being prevented entry into their own subdivisions and condominium buildings, the Quezon City Council passed the Anti-Discrimination Ordinance to protect them. An interesting case that demonstrates the effects of COVID-19 on both the health worker and patient is the experience of Doc Bea. Even before the pandemic, Doc Bea, who works at the Quezon City General Hospital, was being treated for major depressive disorder, though she was functional in every sense. When the pandemic struck, she went through what most health workers experience: intense anxiety, insomnia, mental and emotional instability caused by the escalating number of deaths she had witnessed, and a creeping sense of depression and helplessness. Her emotional and mental state was already on the brink when she was physically assaulted by a patient at the COVID ward, who himself was mentally unstable. She recounts her ordeal. Kinausap ko siya ng mahinahon. Pinakiusapan ko siya bumalik sa bed niya. Walang pasabi, bigla niya akong sinabunutan at pinagsaktan. Nasa sahig na ako, sumisigaw at humihingi ng tulong, pero walang nakakarinig sa atin. Akala ko malapit na akong mamatay. She was referred to the Department for Psychosocial Processing, where she was registered for the Big Brother program, a special program for health workers with psychiatric comorbidities. The early intervention averted the development of an acute stress disorder, a condition where an experienced trauma results in nightmares and a continuous reliving of the traumatic experience. Prescribed with medication and now undergoing therapy, Doc Bea presently continues to do her rounds at the COVID ward of the QCGH in an emotionally and mentally stable condition. Though she recently encountered a COVID-19 patient in the process of inflicting self-harm on herself, Doc Bea succeeded in persuading and even counseling the patient to seek help instead. And despite exposure to the patient's unpleasant circumstances while she was listening to the patient, she no longer experienced a recurrence of her depressive state. Indeed, it is clear from the examples above that living in the context of the pandemic could have caused irreparable harm had interventions not been available. The case of Marlon is perhaps the most typical. He worked at a salon, a business not allowed to operate for the most part during the quarantine period. Like thousands of others like him who had lost their only means of livelihood, he suffered insomnia and worried excessively to the brink of paranoia. He was also burdened by the pressure of having to provide for his parents, nieces, and nephews. He collapsed silently in a depressive state and refused to seek assistance. He later got infected by COVID-19 and was taken to our Hope Quarantine facility, which he now considers a blessing. During his admission interview, he was diagnosed with severe anxiety. He received both treatment for COVID-19 as well as for his mental problem, which continues to this day via teleconsulting. He also gets refills of his medication for free at our health center through our Mental Wellness Access Hub, or MUA, as we call it. He narrates, "Maganda ang nangyari sa akin nang nagka-COVID ako. Inaalagaan ako ng husto. Lahat libre, pati pagkain. Ngayon, pati anxiety pills ko, nakakamit ko pa ng libre din." Marlon was one of the lucky ones, however, as international studies have shown that COVID-19 can lead not only to extended physical afflictions, but likewise to mental complications such as delirium and agitation in the long term. A few years ago, 3 of my friends lost their children to suicide almost at the same time. Much earlier than this, the best friend of my niece, who was in high school then, had hung herself from a tree over an unfaithful boyfriend. This prompted me to raise the issue of suicide as something that could be taken more seriously in our public schools. To my query, the then assistant school superintendent replied, "Ma'am, ang mga mayayaman lang ang nagpapakamatay. Matibay ang loob ng mga mahihirap." Just last year, however, 2 public school students from Quezon City took their own lives by jumping off the top floor of 2 malls. Suddenly, suicide became an area of serious discussion in our school board meetings. With the advent of COVID-19, the problem is finally getting the attention it deserves. Latest figures from the Philippine Statistics Authority, or PSA, show that suicide incidents rose 25.7% in 2020. In Quezon City, the number of suicide cases rose by 22.54% in 2020. And most of those who committed suicide belong to their 20s and early 30s. Just as there are more women than men seeking mental health interventions in Quezon City from our various agencies, there are more men at 90% who take their own lives compared to women. So this must be an area of study for gender rights advocates. In contrast to the earlier conclusion drawn by our assistant school superintendent, 83% recorded suicides in Quezon City hail from low-income families. A profile of the victim indicates that almost all of them had pre-existing psychiatric, depressive, or anxiety disorders, or were substance abusers whose conditions were exacerbated by the uncertainty, social isolation, and economic problems associated with COVID-19, which makes me think that had they sought interventions earlier, their fate may have been different. My interest in mental health issues goes way back to 2010 when, as vice mayor, my office partnered with the Natasha Goldborn Foundation to commemorate World Suicide Prevention Day. Founder and president Jeannie Goldborn told me she had approached many mayors and not one wanted to work with her foundation. I was the only local official willing. But even as a newly elected official, I knew it was an issue that government had to confront, even if mental health issues were not considered fundamental health concerns at that time, and few, if any, LGUs had policies and programs to address them. 11 years later, mental health as an advocacy is still in its infancy in Quezon City, with our first ordinance mandating a community-based mental health program passed as recently as 2015 only, though still earlier than the National Mental Health Care Act of 2018. And a more comprehensive law or ordinance is now still at the committee level in our city council. Hopefully, this will be passed early next year. However, because the need had been recognized as early as 11 years ago when we first engaged our youth leaders, we had put in place a variety of interventions accessible to our people depending on the gravity and nature of their symptoms as early as 2011. To date, help is available at our Protection Center, Social Services Development Department, our 3 local government unit hospitals, our health centers, all 67 of them, and our sundown clinics. These are clinics that operate at night, and our Kabahagi Center for Children with Disabilities. Many challenges remain, however. Chief among these is the need to increase investments in this underfunded sector to expand mental health services to more people. Ironically, the demand for mental health services is exponentially increasing because of the pandemic, but the pandemic is also the primary disruptor of critical mental health services. According to the World Health Organization, COVID-19 devastated access to and also siphoned funds from mental health services in 93% of countries worldwide. Judging from Quezon City's experience, this could well be true for our country. Our own budget for psychotropic medicines decreased from 2020 to 2021 because the medicines could not be dispensed and were just being accumulated in our various health centers, not reaching the patients. Moreover, our full-time specialists had to multitask as vaccinators to the detriment of mental health service delivery. Meanwhile, progressive thinkers suggest including mental health programs in LGU economic recovery plans, because studies have shown that for every $1 spent on evidence-based care for depression and anxiety, a return of $5 can be expected in terms of productivity. Again, I'm citing a World Health Organization study. But before we can even incorporate mental health in our recovery plans, we need to significantly improve mental health-seeking behavior among our people and overcome the cultural stigma associated with mental health conditions. We must end the fear and the root of that fear: exclusion, bullying, ridicule from others. We must conquer ignorance. We must drive home the point that seeking help is a sign of strength, not a sign of weakness. We must fight for a kinder, warmer, more compassionate, empathetic, sensitive, and inclusive world. Just as I proposed including reproductive health, violence against women and their children, HIV/AIDS, and LGBTQI issues in the local school curriculum, I have proposed the same for mental health, because I believe that change can only begin when we target our school children, who will be the leaders of the future. We can end the shame by educating our children. And to be honest, this learning should have started yesterday. Thank you very much and have a pleasant morning.
Thank you for that talk, Mayor Belmonte. I can really see how the local government units have been on the ground and are considered frontliners themselves. Let's get the ball rolling now with our next guest for today's National Mental Health Summit. She is the officer in charge of the Department of Health's National Mental Health Program. And as the division chief, she spearheads programs promoting the overall wellness of all Filipinos, including the prevention of mental disorders and improving access to quality care and recovery. Here to talk about the effect of COVID-19 on mental health and its importance to national recovery, on stage is Ms. Francesca Cuevas.
It was such a joy to listen to Mayor Belmonte, and I think the way she presented the mental health program in Quezon City is something that local government units should be able to emulate. And I come from the Department of Health, and as a program manager in the Department of Health, there are certain things that we need to be able to pursue, like a framework that we need to put together. But let me share with you my topic this morning, which is the effect of mental health, of COVID-19 to mental health, and its importance to national recovery. Okay, so next slide, please. Sorry. Okay. Let us just, para lang palarehas yung terms of reference natin when we talk about mental health. And I think kanina na siguro nasabi na yan lahat kanina. And just would like to be able to say that kailangan, we have to understand that mental health is a state of well-being where every individual na-realize niya ang sarili niyang potential, nakakope siya sa normal stresses of life. Well, the pandemic today is not really normal. Can work productively and fruitfully and is able to make a contribution to his or her community. So, yun po yung pinag-uusapan natin. Could I take off my mask? Okay, sige, thank you. Able to make a contribution to his or her community, and that is something that we need to put in mind when we talk about mental health. Okay, next slide. I just would like to make this clear about this data. This is a data that we got in 2020, early 2020, when we have the Special Initiative for Mental Health, technical assistance that was provided with the World Health Organization. So the Philippines is one of the 6 countries that were provided assistance to improve delivery of mental health services in these different countries. And when we got this, we used the data, global disease, burden of disease in 2017, 17 extrapolated to our own population in 2020. Extrapolations po lahat ito. And ito po yung result niya, no? And gusto ko ring sabihin that the result really is, if you're going to take a look at the real spectrum of the disease, of mental health disorders in the country, medyo underestimated po ito. Kasi, ilang ano lang siya, depressive disorder, bipolar, schizophrenia, so 7 major disorders lang. And there are a lot. And extrapolated siya, and if you're going to put them all together, it's 3.6 million. Sinasabi natin, 3.6 million yung may pre-existing mental disorders prior to the pandemic. Hindi natin alam sa ngayon kung ilan talaga ang nagkaroon during the pandemic. Kasi alam naman natin, hindi naman overnight na mangyayari ang isang mental disorder. It is a long process, and maybe a single traumatic experience can probably trigger, no, the development of the disease. Talagang frank symptoms na ang makikita mo. But it is a real long process para siya magkaroon ng disease. So, when we talk about this, we are still awaiting the result of the current study that we have for the prevalence survey. It was interesting to note that supposed to be matapos na itong prevalence survey namin ng 2020, but because of the pandemic, na-push siya 2021. Again, lockdowns and everything just pushed it again. But we were able to get data from 7 regions already. So alam naman natin, 17 regions po ang buong bansa. We cannot get a national prevalence, but we have prevalence from each of the 7 regions already. And we can see that there are some differences. Medyo mataas dito sa isang region, mababa dito sa isang region, and we would like, and we would be very interested to see why is it that this region is much higher than the other region. We will still be waiting for the result by the, sabi ng UP, PGH, it will be towards the end of the first quarter of the year next year because of the lockdowns. Kasi personal siyang ginagawa, hindi siya virtual. This is a personal face-to-face interaction with our respondents. So, next slide, please. So as we said, and I'm sure kanina pa natin pinag-uusapan, the coronavirus, the pandemic really has been inducing a lot of fear, anxiety, and worries para po sa atin. And certainly, elevated po yung levels of stress and anxiety sa ngayon because of this pandemic. Next slide. Hindi ko na tag-isa-isahin, no? In 2020, nakikita naman natin, SWS, talagang increase po yung levels of stress ng mga tao. 86% of Filipinos were stressed over the pandemic. Next slide. And the psychological impact, no? 1/4 of the respondents reported moderate to severe anxiety. 1/6 of the respondents reported moderate to severe depression and psychological impact. Next slide. And if we are going to take a look at our NCMH hotline, we had the hotline operational last May of 2019. Kung titingnan po natin, from May to December 2019, ang total calls lang nila, of course, was just around 4,000, a little less. Suicide calls would be 9.8% of the total calls. But in 2020, suicide calls is already around 13%. And if you are going to take a look at, as of September pa lang ngayon, calls in the NCMH hotline has already had such an increase that even the suicide-related calls is almost 1/3 already of the calls, September pa lang. Ang ibig sabihin nito, sinasabi lang natin, that people are now trying to, there is a positive thing, no, for an increase in calls para sa amin sa hotline. Because it means that people are now recognizing and that they are now able to reach out to, for help from the professionals. So it's not a bad thing to see this, but also at the same time, of course, it is troubling because medyo dumadami yung mga calls natin dito in terms of suicide. Most of the calls were coming from NCR, Region 3, Region 4, and mostly females, and a large majority are from the 18 to 30 years old. If we are going to take a look at the top reasons for calling, tiningnan ko rin yung 2019-2020 data namin. Walang pagkakaiba actually. Ang reasons, nagkakaiba lang siya actually sa number 4, number 5. Problems in the family and love relationships. Nag-change lang sila sa ngayon. But if you are going to take a look at the top reasons, anxiety, depressive symptoms, referrals to hospitals and professionals, yun po yung pinaka-top reason nila for calling the hotline. Next slide. Another data that is very current sa ngayon is an 8-country, 4-continent data on the evolution in anxiety, depression with the progression of the pandemic. No? So, isa ang Pilipinas dito sa mga bansa na tiningnan. Let's take the next slide. And if we are going to see at this point in time, 30.1% yung phase 1, so overall, in terms of the probable generalized anxiety disorder, and 32.5% on phase 2. And there is, they said, an almost 8% increase over time. Ibig sabihin, ay habang humahaba ang time ng pandemic, mas lalong tumataas ang percentage of the population that are experiencing generalized anxiety disorder and major depressive disorders. But what is also very troubling for the Philippines is that in the different variations among countries, it is noted that it is much higher in the Philippines, 38.8%. Compare mo doon sa Switzerland, which has the lowest. So, at ang mga proportion dito is exceeded among 50% among young adults. Kumbaga, tatamaan talaga yung mga young adults, 18 to 24 years old in all countries, again, except in Switzerland. And there are several factors that influence mental health in the times of pandemic, as they saw it. Young age, weak sense of coherence, siguro kasi hindi alam kung ano ba talagang totoo, di ba? Ang daming mga information ng mga nagli-leak na hindi tama, pagkatapos hindi maintindihan kung ano nagkaroon. There's no coherence at all in all of the things that are ongoing. False beliefs, self-isolation, and quarantine. So all of these are negative factors for mental health. Next. And there is also a recent study that 1 in 3 COVID-19 patients will be diagnosed with a neuropsychiatric condition in the next 6 months. So if you had COVID, you would probably be one of those 1 in 3 who would have some of these neuropsychiatric conditions. So kami sa Department of Health, para po matingnan po ito, is next year, we wanted to be able to take a look at this one. What would be the neuropsychologic sequelae of COVID-19 among the different patients. So it will be some kind of a research that we'll be doing. So watch out if this is going to be asked about and for some of the firms probably to deliver this. So next slide. I remembered or I listened in earlier to one of the speakers and he said, tama parehas kami ng since we are not all in the same boat, we are actually in the same ocean, in the same storm. Kasi yung iba, nasa cruise liners, yung iba nasa ship, yung iba nasa bangka, probably some are on the paper boat. So, but all of us are experiencing this pandemic. No? Kaya lang iba-iba lang ang sitwasyon natin. And that's the reason why when we are going to respond, next slide, ang ating response really is using the MHPSS intervention pyramid. So this is the pyramid that we use when we respond to any types of emergency. And this is the same thing with the pandemic as of the moment. What would be the first thing that we need to do? The first thing that we need to do is stabilize the economic condition, socio-economic conditions of people. That's the reason why the government was really providing for all of those and economic support, no, that they can give, no, ng mga ayuda that they can give, the allowances that we're able to give to the population para lang ma-bail out natin yung mga hindi wala ng trabaho, nung walang mapupuntahan because of the pandemic, so that at least more or less people would be on an equal footing. And then, pataas na yan kung ano man ng mga interventions na pwede pang natin gawin sa kanila. Next slide. In the Philippines, ito po yung ginagawa natin. So we provide food, water, and all of these things for the basic services and security. And then for people in the communities, we provide community and family support. Kaya kanina tuwa talaga ako sa Quezon City for all of the community support that has really been ongoing, very tangible, and very there, no, in the community, and very reachable ng mga peoples in the communities. And then when they need probably already specialized care, then we already have our psychologists, psychiatrists, and maybe if they need really hospitalization, then we can bring them to the hospital. So when we respond, ito po yung ginagamit natin na a pyramid of interventions. Next slide. And pakita ko lang sa inyo, no, ito yung report namin from July to August, kung ilan na po yung nabigyan, so on and so forth. And these are the different agencies of government that has been providing all of these, mga local government units, and all the other agencies of the government mandated to provide. So, para lang makita ninyo na meron talagang ginagawa para dito. Next slide. So, what were our best practices in the COVID response that we have? I felt that I need to be able to probably show this to you para lang makita na yes, we have an organized way of responding to pandemics or to emergencies and disasters, crises like this pandemic. And we were able, of course, to develop policies. Alam niyo naman, ng gobyerno talaga, par central office, polisiya talaga yan, standards, guidelines. And we have, of course, coordinated with a lot of people for partnerships with different organizations, local government units. We were posting a lot of information materials. We have established our psychosocial hotlines, not only in NCMH, but all over the region, all over the country, the different regions that we have in the country. We have specific hotlines and helplines that are available for people to use. We have a one-stop shop for our overseas Filipino workers who are coming back. No? Pagdating nila sa airport, meron na pong mga binibigay sa kanila. And then we conduct, of course, MHPSS services for different target groups. So I'm happy to note that there were discussions about women and children in this forum, and we also would like to be able to tell you that MHPSS is really targeted to different types of individuals and target groups. Next slide. So let me just say this, that good mental health is critical to the functioning of the society at the best of times. So kung walang pandemic, walang crisis, when everything is going on smoothly, mental health is very, very important. However, ngayon na meron tayong pandemic, ngayon na meron tayong crisis, mas lalong napaka-importante ito. It must be front and center of every country's response to and recovery from the COVID-19 pandemic. And I just gave the good mayor, Mayor Belmonte, a investment case, no, for the Philippines, saan natin ilalagay ang pera natin dito sa Pilipinas when it comes to the provision of services for mental health in this country. Anong mga interventions, mga gamot na dapat nating gagamutin, and so on and so forth. So this was done in a more scientific, evidence-based way of doing it. Together with the United Nations and the WHO and all the other developmental partners that we have. So this was given to us this was a policy brief that was issued even last May 2020. Next slide. Sa ngayon, we have now entered a new era, no, of psychological suffering and rising demand for mental health interventions. I think lahat po tayo ay naka-realize niyan. And along a continuum from health promotion to specialized care. But more than ever, kailangan natin mag-innovate and mag-build ng interventions which is aimed at strengthening key protective factors. So napaka-importante po yung mga key protective factors such as a sense of coherence in the fight against the adversity caused by the concurrent pandemic and infodemic. So may pandemic na, mayroon pang infodemic, and so we need to have key interventions to protect ourselves from such kind of incoherence. Next slide. Thus, as I told you earlier, we already have here an investment case for the Philippines. We know where we would be putting in our money in terms of the provision of mental health services. And I hope that local government units and legislators and economic managers are going to be using this and then helping us, put investments into all of these areas. We also have a special initiative for mental health, which WHO is helping us with to really make sure that mental health services are being provided in the country. Next slide. So what do we have? We're very happy that we have the Mental Health Act, and this is one of the major plus for mental health in the country dahil may mandate na po tayo. Meron na po tayong legal basis for doing all of the things that we need to do, particularly in putting money where investment should be. Next slide. And ito po yung objectives ng Mental Health Act. But I will not go deeper into this, but just to let you know that we are working along these lines. All of these objectives are now unti-unti na naming nalalagyan ng laman, unti-unti na nating makakamit ang mga bagay na ito. Last week po, meron kaming public health convention ng mental health, and we were able to show to them, kasi may scorecard po yung Department of Health and all the other government agencies that are working on the Mental Health Act according to their mandates. And pag red siya, ang scorecard, pag red, medyo wala pang nagagawa. Pag yellow, medyo marami nagagawa, nasa middle na. Pag green siya, medyo towards the end na tayo and ma-achieve na natin. And we were proud to say, we were happy to note that most of the indicators that we have is at least already on the yellow side. Ibig sabihin, a lot of things are already being done in order for us to be able to achieve our objectives. Next slide. And ito lang po yung, ang pinapakita ko lang sa inyo kung ano yung framework na sinasabi natin when we talk about mental health in the country and how do we implement them. We are saying that it is a whole of society, whole of government approach. No one is just the one that is accountable. All of us are accountable. All of us are there. All of us are supposed to be mental health workers. And thus, it is a whole of society, whole of government approach. The health system is there to make sure that when people are already identified to have illnesses, there are interventions that are being provided. But let us make sure that the environment is going to be something that will promote mental health. Kaya the society, the local government, the communities are able to put up and set up a community or a place where people are going to be promoting their mental health. So we would like to be able to do prevention and promotion, provide the services that are needed. We would like to be able, of course, to govern a mental health program accordingly, and we need to have more research and information about what's happening in the country when it comes to mental health issues. Next slide. And these are some of our accomplishments and strategies that are based on that. But I probably would like just to be able also to point out that we have a community-based mental health program. Mayor Belmonte, I saw that you had this 2015 AO or administrative order already. Yes, on ordinance, yeah, for community-based mental health program. Kailangan ko makita yun para matingnan namin because we're developing a community-based mental health program where local government units should be able to pursue. And it is something that is not that is really more for the communities to do. So yung common the people in the communities, the nanays, the tatays, the neighbors that we have, somebody who is just right there, residing in the community to take on and being empowered to do the things that they need to do to help each other. Kaya kanina I was glad also to be listening that there are organizations that are pushing for workplaces, di ba? So workplace sa community. A community, a local government unit place is a community. So a school is a community. So this basic empowerment to do to promote mental health, and to provide the services that are necessary and are needed is very important para po maano natin talaga itong programang ito, community-based, because this is where we need to really put our investments on. Next slide. So the current situation in our country is hindi tayo marunong mag-self-care. I mean, people in the country really do not understand what self-care is. Parang hindi natin. So, pinaka-inverted yung pyramid natin. We have few tools probably to help each other on how to care for ourselves. I remembered yung mga mothers, we don't really care for themselves. They are very good in seeking help for their families, husbands and their children. Health-seeking behavior nila napakataas when it comes to their children, their families. But kung sila na may nararamdaman, tinatago na nila yan. And they don't want anymore other people, and they don't want to seek help actually for themselves, but for others maybe. But we need to be able to ensure that we invest in ourselves. Informal community care is very important, kaya ang communities ay dapat, are going to be empowered to do all of these things. We have primary health care in integration of services, kaya tinuturuan natin yung primary care facilities, mga rural health units, clinics, city health offices ng MHGAP. This is an intervention guide where doctors and nurses at the level of the primary care are able, they are not specialists, they are primary care workers, and yet they are able to identify common mental health disorders and are able to provide the interventions that is needed or the interventions that are needed for that specific person. So tinuturuan po sila, and we wanted to make sure that by 2022, the end of the year, in preparation for the Mandanas ruling, lahat na po ng mga local government units are able to provide, the services that are necessary kasi ibababa na po sa kanila yung mga funding support in terms of the medicines that we are going to be providing for our patients. So ang mga mental health services, we are at this point in time trying to make sure that all of the hospitals will be able to provide mental health services. So licensing yan ng mga hospitals, including private hospitals. So kahit anong klaseng hospital ka, you should be able to provide a mental health service. Kahit man lang, an emergency care, that is something that you can do. So depende po yun sa level mo ng kung paano yung services mo available, but you should be able to provide the service. And para po yung mga specialist hospitals natin katulad ng NCMH ay ma-deload na natin. So we will be deinstitutionalizing. We will no longer be really making, have our patients stay in the hospitals for a long time, but we need to mainstream back to the community, kaya kailangan natin ang ating community-based mental health program sa sinabi ko kanina, and primary care is going to be done well. Okay, so next slide. So we have the opportunity to address this long-standing gap and build preparedness in terms of anong lacking sa ating capacity building, human resource, investments, etc., for a stronger mental health system for the future. And the last slide, please. And so what we would like to be able to see is from an inverted pyramid, we would like to see this as a desired reality. Ibig sabihin that people in the community, kahit ikaw, kahit tayo, lahat ay alam natin kung paano i-care ang mga sarili natin, promote mental health care by our own selves and our own families, see people and are able to understand who they are and help them. And probably kung may nakita tayong mga red flags sa kanila, we would be able, to immediately refer them to some people who would probably be able to help them. And all of these can be done at the level of the families and communities, and that's what we are trying to do. And the primary care level, yung mga city health offices, mga clinics natin, mga RHUs natin, are able to provide care when it comes talagang may mga symptoms na sila. So that when kung ang hindi na talaga kakayanin sa local level ay particular emergency, nagwawala na talaga or kailangan talaga ng mga specialist care, then they are able to go to the different hospitals that we have in the country. So this is what we would like to be able to do. No? We don't want our patients to flock into the specialist care level. We would like everybody at the level pa lang ng families, our homes, our families, our communities, we are able already to provide services that are needed. Kahit man lang listening to that person, even just, understanding them, even just picking up red flags and knowing saan ko to pwedeng ilapit. No? So to whom will this be referred to para matulungan siya, para hindi na siya lumala, and we would be able, to live our lives accordingly. So, ladies and gentlemen, ito po ay gusto natin, this is our desired reality. As you can see, we are still in the third year of the implementation of the law. Actually, the pandemic has brought out a lot of inefficiencies in our system, but that's okay. Ganun naman talaga eh. But we would just like to build back better. So in any disasters, in any crises, in any humanitarian critical situations that would arise, including this pandemic, we have seen where we are weak at, but we also are able to be hopeful that we'll be able to build better next time, so that when the next pandemic comes, we are now more fully prepared. So thank you, ladies and gentlemen.
Thank you so much. So our next speaker is the director of Loyal Schools Gender Hub and the association professor of the psychology department at the Ateneo de Manila University. Today, she has eye-opening insights for us about breaking the binary and breaking the stigma surrounding the LGBTQIA+ community. Let's give it up for Dr. Mira Alexis P. Ofreneo.
Hello. Today, I will talk about a gender-inclusive psychology, and I will do this in 3 parts. First, we will break the binary. It means introducing us to the diversity of people's genders and sexualities, unpacking what SOGSC means. Second, we will break the stigma. We will go to the root of the problem that our LGBTQIA+ community faces, and that is the stigma, the marginalization, the exclusion in society. And third, we will make a call to be part of change, a call for affirmation, for validation, and love. So let's begin with part 1, breaking the binary. What do we mean by this? Let's start with the binary. The gender binary is a construction, an idea that there are only 2 sexes or genders in the world, male, female, man, woman. And yet, in that construction, we expect male in biology to identify as a man, to express oneself in a masculine way, and to be heterosexual. In the same way, we expect a female in biology to identify as woman, to be heterosexual, and to express herself in a feminine way. So inside this gender binary, this construction, are many constructs, many concepts, which we now unpack. And when we unpack those many constructs, as you see here in our gender unicorn, we have identity, expression, sex assigned at birth, physical attraction, emotional attraction. No? We get to see that there are more than two types of people in the world in terms of gender and sexuality. We see that there is a diversity of humanity beyond two sexes. Let's look at them one at a time. First, let's start with sex assigned at birth. You're looking at organs, hormones, chromosomes, where our biologists, our medical professionals will assign us at birth to a category, a sex, based on what they see in terms of our reproductive system. Are we female or male? But we are now recognizing that science shows there is a spectrum of biology, no, of sexual anatomy, of sex characteristics beyond female and male. And not everyone falls neatly into these two categories. And therefore, we also have now people who identify as intersex, who are categorized as other sexes beyond female and male. We can look at gender identity. How do we see ourselves? Do we see ourselves as a man, a woman, or other genders? Do we, for example, identify as non-binary, neither female or male? And then how do we express ourselves? And so our sex assigned at birth does not automatically translate to our gender identity or even how we express ourselves. So do we express ourselves in how society sees our behaviors as more masculine, as more feminine? There are people now who identify as gender fluid, who rather express themselves, no, in a variety of expressions. And then we go into sexual orientation. Who are we attracted to? Who do we fall in love with? No? Do we fall in love with men, with women, or with other genders as well? And so this unpacking shows us the diversity. I know this might seem intimidating and confusing, that there are so many letters, but this is to show you that there is even more. There's so much more diversity in humanity beyond LGBTQIA+. Even in the Philippines, our own construction, for example, of being tomboy, of being bakla, or in other countries and cultures, no, that do not come from a Western background. For example, the Kathoy in Thailand, the Hijra in India. There is more than this. Following this rainbow, for now, we will unpack what we see here. We begin with L, lesbian, women primarily attracted to women. Gay, men primarily attracted to men. Bisexual, person attracted to one's own gender and another gender, but not all. No. A transgender person whose gender identity, how they see themselves, is different from one's sex assigned at birth. For instance, those who are assigned male may eventually identify or see themselves as women, or those assigned female at birth may see themselves as men. So we have trans women and trans men. We also have transsexual, which is an outdated term to refer to people who have undergone sex reassignment surgery or hormonal procedures in terms of gender change. We also have queer, which is sometimes used as an umbrella term for different identities that make up the LGBTQIA plus community. We also have those who are questioning, exploring their gender, their sexuality, intersex people whose biological or sexual anatomy does not fit the traditional markers of male and female. We have allies, non-queer persons who support LGBTQIA rights. We have asexual people who do not necessarily feel desire or any sexual attraction for any group of people, or pansexual people who experience attraction to all gender groups. And so with this diversity, we see that there's more than the binary. There are many ways of being a man, of being a woman, of being any gender. Many genders, many sexualities, many ways to be a human person. Now let's go to part 2. Breaking the stigma. What do we mean by this? Let's start with this idea and this assertion. Because in psychology, we see nothing wrong with being lesbian, gay, bisexual, transgender, queer, intersex. We see nothing wrong with being part of the LGBTQIA plus community. And yet, there's something wrong with a world that excludes people, marginalizes people, stigmatizes people for who they are, for their gender and sexuality. There's something wrong with the world. There's nothing wrong with people. An LGBTQIA plus identity is normal, healthy, valid, moral, acceptable. And yet, with the stigma in society, some social groups, some communities, some institutions, some spaces will construct an LGBTQIA plus identity as abnormal, unhealthy, or disordered, invalid, immoral, sinful, unacceptable. This is stigma. And so in this ecological model, human experience, the experience of our LGBTQIA community of stigma is in the social. The problem is in society that stigmatizes a person for one's gender, one's sexuality. And that stigma creates significant distress, creates minority stress, creates mental health issues and mental health problems. What we are asserting here is that the problem is social. When there is stigma in society, when you are marked, your identity, who you are, is stigmatized, the feeling, the experience is as if society is telling you, you don't belong here. Society is rejecting you. Society refuses to accept you. You don't belong. Imagine that feeling. Imagine that experience. And this kind of rejection is multi-layered. It can be in culture, wider culture. It can be in religions, in schools, in peer groups, with friends, and even inside one's own family. What will you feel if you are not recognized in the law? If you are denied rights? If you are not protected from discrimination? If you are not granted certain privileges? How will you feel if people see you as morally unacceptable, as sinful, or if you're bullied in school, ridiculed, teased, excluded, even isolated by peers, or rejected by one's own family? These are very real experiences of our LGBTQIA plus community, experiences of rejection. And sadly, at times we may not be aware of it, but we could be part of the problem when we ourselves reject an LGBTQIA plus person. This is the discrimination, that stigma on the basis of SOGI-SC. And sadly, this is also experienced in terms of gender-based violence. Even in our country, in the Philippines, we have members of the community who are hurt, are harmed, are violated, are targeted by hate crimes. We have Filipino trans men, Filipina trans women murdered for their gender. And so this is a serious and grave problem. And it can translate into the psychological. It can become internalized, this stigma. Internalized transphobia, internalized homophobia, internalized biphobia, making our LGBTQIA plus community an at-risk population for mental health issues. LGBTIQA plus youth are 4 times, imagine this, 4 times more likely to attempt suicide, experience suicidal thoughts, engage in self-harm. LGBT people are 3 times more likely to experience a mental health condition and 2.5 times more likely to experience depression, anxiety, substance misuse. What can we do? So for our third part, I wish to make a call to be part of change. Can we change this world? Can we change the world that excludes people for who they are? Can we be part of affirmation, of validation, and love? This is our vision, a gender-inclusive world. How can we be part of change? To create norms inside our groups, inside our communities. No? To change the norm so that everyone will feel that they belong. Everyone deserves to be accepted, respected, valued, and loved. Just as this mother is telling other parents, our children deserve our acceptance. Our children deserve our love. We can become an LGBTQIA plus ally. Just as this woman is telling the world, loving people is not a sin. So let's try to address the problem. Counter the stigma. How do we destigmatize? Remove the stigma from people. Sending a message, you are normal, you are healthy, you are a human being. Our LGBTQIA plus community, embracing them, telling them that they are normal, healthy people. Counter the discrimination by practicing respect, acceptance, because when we say, I accept you, that is a message that society accepts you. When you say, I respect you, that is a message that society respects you. This affirmation, this validation is key. Let us tell our LGBTQIA plus community that you deserve to be respected, that you deserve to be loved. And when we become part of affirming an LGBTQIA plus person, we facilitate their acceptance as well of themselves. We show them that the world can be a loving place, that our community, that our group can be a loving place, a welcoming place. And with that, I will end with 4 S's. Stories, safe spaces, support. Just as we are doing now, we are listening to stories. We are knowing more about the community. And that is being part of change. That is creating a more loving world. By listening to stories, allowing people to share their stories, particularly personal experiences, listening to people's own personal journeys. The second is creating a safe space. And this is what we are doing also now. Practicing non-judgment, affirming that any sexual orientation, gender identity, gender expression, sex characteristics is psychologically, socially, and morally acceptable. And the third is to link people to support, to build connections, to show that there is social support, emotional, moral support inside our communities, or to link people to resources. With that, we can become part of changing the world and allowing our LGBTQIA+ community to feel accepted, respected, and loved. Thank you so much for listening.
Okay. From the realm of sports, let's now shift gears and talk about the youth. Our next guest is a young achiever and pageant veteran from Angeles City, Pampanga. Recently, she also placed as a semi-finalist in Binibining Pilipinas 2021. Here to cover the mental health landscape of the Filipino youth, let's welcome to the stage Miss Francesca Taruc.
Hello. Maya Paaldo po kay Kayungan, or good afternoon everyone. I am Maria Francesca Taruc, Binibini 28, and now the face of Araneta City. I'm here today to talk about a topic that is very close to my heart because at the age of 23 years old, I am also part of the youth, one with many dreams, many passions, and many challenges too. Before we dive deeper into numbers, let me tell you a story about myself. I was a strong, independent woman. I was working a lot and earning a lot, doing pageants left and right, and studying at the same time. But weeks before my graduation, my father passed away, and it was really devastating for me. I was really down in those times and hindi ko alam na makakapag-move forward pa ako. But then, weeks after my graduation, I received a call that I will be competing in an international competition, which is the Miss Tourism World Intercontinental 2019. And I believe that my father was guiding me throughout my journey because I was grateful and fortunate enough to win the crown for the Philippines. And after that, I was invited to guest in different TV shows, and I even got the chance to be a TV show host at Wawawin. And I also had a teleserye in GMA. It was Sahaya, and I was Ombo Putli there. It was another time of my life where I had plenty of works and got to meet many people from different backgrounds. I also got the chance to travel to different countries. It was truly a life I dreamed about, and I was grateful for it. But one day, I just dropped everything. I had so much anxiety and triggers. One of those thoughts was that if I go to work, my partner might cheat on me. Because I was a workaholic, I spent most of my time working. And you know, the time that I was not working anymore, it was a brand new set of questions that triggered my anxiety all over again. Like, how can I pay my bills? How can I support myself and my loved ones if I'm not earning anymore? I was really down on those times, worrying to the point that I was just sleeping everything away. Drawing from personal experience, being a young person is never easy. Being one, you are in that stage of life where you dream big and you try to figure yourself out and your place in the world. There are so many challenges that the youth face today in many different ways, in many different aspects of life. One of these struggles is online learning. 1 year plus into the pandemic, face-to-face classes have been transformed into virtual setups, and many students are finding it difficult to adjust. We've been hearing many kids, high schoolers, and college students trying to catch up with their lessons, getting overwhelmed with unrealistic expectations, tuition fees shooting up, and not having the financial means to provide for their electronic gadgets they now need to learn. And that's just some of their concerns. I would also like to commend those government officials and other sponsors na tinutulungan po ang ating mga estudyante na bigyan po sila ng gadgets or laptop na kailangan po nila sa kanilang pag-aaral ngayon. And when we see the numbers, it will put things into perspective better. Guys, did you know that around 53% of senior high school students experience extreme level of anxiety, while around 22% experience stress levels? Even in college students, the pandemic of loneliness has taken effect, with around 23% feeling severely lonely. And that's just on online learning and lockdown's unfortunate effects. Grabe, no? But I'm just getting started. There's also the real issue of family or domestic abuse. Because of the lockdowns, everyone has been encouraged to stay at home to lessen the spread of the virus. But what is happening inside the homes of the Filipino youth? We don't see it in the headlines, but you know, violence happens inside those four walls where the youth are supposed to feel safe, and yet this very safety is being taken away from them. Did you know that the Philippines is shown to have one of the highest rates of mild domestic corporal punishment in the world? Plus, on average, 4 out of 5 Filipino young adults have experienced minor physical violence during their childhood, while 1 out of 4 actually experience severe physical violence. These are not just numbers. The trauma that the youth of today feel when they are being threatened in their own homes can eventually grow up with them into adulthood and affect their daily lives. All these challenges can be too heavy to bear for the youth. In fact, the circumstances are unique, personal, and different for everyone. And sometimes, because of all these overwhelming issues happening at the same time, it can feel like you're carrying the weight of the world on your shoulders. There was a recent survey of young Filipinos ages 15 to 19, and close to 10% of them said that they experience moderate to severe depressive symptoms. Plus, in that percentage, more women were actually depressed 40 times more than men. And what does this shows us? It just points to how depression is very real to the youth. Hindi lang siya gawa-gawa, and loneliness could even be a symptom. And how do we cope up with depression? Di ba, minsan we just want to deny it or ignore it kasi we feel like when we do, mawawala na lang siya. We deny or ignore it, and then we want the feeling of escape to pass away time to numb the pain. For some, the tendency is to turn to unhealthy coping mechanisms that can lead to addiction. It's not just about drug addiction or alcohol addiction, but it could also be an addiction to their smartphones. Sa mga youth na nakikinig at nanonood ngayon, how many of you can honestly say with full conviction that you can live without looking at your phone for a day? And the numbers don't lie. Our data shows that in Filipino adolescents, close to 63% are dependent in their smartphones. In fact, Filipino adolescents spend 7 hours on it during weekdays and 8 hours on it during weekends. And did you know that this addiction alone can have negative effects on our mental health? Just imagine seeing all those posts on social media, and sometimes you can't help but feel envious or compare yourself with others. Plus, hearing all this bad news and all the negativity and trolls on social media, it is really harmful, and you have to be on your guard. The same can also be said about online gaming. That could be an addiction in itself too. Research shows that adolescents aged 15 to 18 years old were prone to this. And actually, the numbers are rising. And magiging honest po ako, isa po ako sa na-addict sa online gaming, specifically Mobile Legend. Minsan, nakakalimutan ko na po maligo, kumain, or matulog dahil sa kakalaro lang. Ngayon, naglalaro pa rin po ako, pero in moderation na lang. And did you know that these unhealthy coping mechanisms might seem passive, but there's a real struggle that lies underneath if ignored. This can lead to suicidal thoughts, suicide attempts, or suicide itself. Did you know that for the youth, the common reasons they attempt suicide are because of problems in their relationships with their families and significant others, and also the burden that they feel with their personal problems? Actually, what shocked me the most is how the data points to those as young as 13 to 15 years old contemplating taking their own lives or even attempting it. Napakabata po nila para isipin ang mga bagay na ito. Suicide knows no age or gender, and yet it saddens me that the access to the right resources to prevent this from happening is currently low, and how we still have that stigma about seeking for professional help. There is something else I want to talk about with you guys, and I think this is something the youth can really relate to. Do you know the feeling of losing sight of your purpose? Because I felt that too. That is why I decided to join Binibining Pilipinas, to regain myself back, to win myself again, to bring back the strong, independent Francesca. And I'm happy to say that I'm back on track. I will never forget this line that was said to me: breakdown before breakthrough. And I wholeheartedly agree. Personally, I could attest to how having a support system is really important, especially when you're feeling lost or burdened, or yung tipong walang-wala ka na. Iba rin yung may space safe ka. When you have people around you believing in you, listening to you without reservations or judgments, lalakas talaga yung loob mo eh. And so to the youth out there, I want to encourage you. Be the support system you need for others. If you're struggling, don't be afraid to reach out. Reach out to your loved ones, your families and friends, and seek for professional help. You're not weak for wanting help. Remember, when you take care of your mind, you are also taking care of yourself, and that's what truly matters. To the leaders of our nation, I urge you to not look down on us. In these trying times, we need your support more than ever. The numbers we talked about today and the current mental landscape of our youth, those data don't have to reflect our future. Let's work hand in hand to erase the stigma and make this type of conversations normal. Let's take action together to address these mental health issues. The youth in our nation have been growing in numbers. Actually, we were close to 20 million back in January of last year. What more now? Not to mention, the median age in the Philippines is 26 years old. It is the youth that will truly drive the change that we want to see in our nation. And so, we must really make an effort to take care of our youth if we want these changes to happen. By paying greater attention to their mental health, we uplift hope. I believe that with hope, we can still move forward. It feels good to be in front of you all right now, and in hopes that I get to inspire and encourage everyone, especially the youth. Remember, you are stronger than any anxiety, depression, and mental illness. Maraming salamat po.
Thank you to our first batch of speakers for Mind U's first National Mental Health Summit. Up next, we have more speakers lined up from the medical field and even the business sector. So definitely a lot still to look forward to. But first, we will be taking a 45-minute lunch break. For the delegates here at the Novotel Hotel, let's continue to practice social distancing and wear our face masks after enjoying our food to ensure safety for everyone. So we'll be back shortly. See you guys. Let's get to it. Are we all ready? We're done eating. Nice. Okay, so up next on stage is the Vice President HR Head of SM Supermalls for close to 3 years now. As a key decision maker in the company, her advocacy is to transform the employee experience to be the best it can be by employing effective HR strategies, which includes upholding mental health in the workplace. Here to talk about caring for mental well-being as a business decision is Ms. Cheryll Lat-Agsaoay.
Hello. Hi everyone, magandang hapon po. So there is a growing awareness in a lot of companies these days about the importance of embedding mental health care and total well-being programs for employee experiences, engagement, and productivity. But the question which we still get asked a lot of times is it really okay not to be okay when we tackle our jobs in the corporate arena? Well, this afternoon, I would like to share with you our experiences at SM Supermalls as we try to define and embed a holistic well-being program for our employees. And there are challenges, there are wins, and there are insights all in between. But before I deep dive into our experiences, which hopefully you will find a lot of insights with, I would like to introduce first our company. So SM Supermalls is part of the SM Prime group of companies. We are the mall operating arm, managing 77 malls in the Philippines. In fact, our latest mall was just opened last Friday. It is SM Diet, so you can go visit SM Diet. And then in terms of abroad, we also have 7 malls in China. In terms of our workforce, we are 5,000 strong, and we have a relatively young age group with majority comprised of generations Y and Z. And we are also a company which really tries to uphold a gender-inclusive workforce. Now, let me just go right into the question, into the heart of the discussion. So, why is caring for mental health a business decision? And my premise is fairly simple, because I believe that we employ and engage the totality of the person. When we extend our job offer to our candidates, we strive to do a contract, not with just one aspect of his personhood, but it's about the total sum of the person's life experiences, his values, his family, his background, social, professional network. So it's only fitting when we expect our employees to give 100% of themselves on the job. It's only fitting that the company would also provide programs which target to address the mind, the body, and the spirit. That is the premise we are anchoring on. Now, I would also like to share with you that last year, in the height of the pandemic, when it started, I was actually approached by a mother of one of our employees. And she asked me, please help take care of my son. And it was a very unorthodox discussion to have in the workplace because the son had some mental health condition. And it helped make me realize that, especially during a time of pandemic or very tough situations, employers are not just seen as an entity giving or paying for work or services rendered, but really a partner of the employee and even of their family members in terms of caring for their mental health well-being. So it was a realization of what HR also had to do, at least for me. And then, so aside from that, there is this, this saying in Filipino, popular saying, walang personalan, trabaho lang. Well, I do not subscribe to that. Because when we deal with people, there's always an element of personal. And when we deal with employees, you can't just say, it's all about work, stop talking about your problems at home. It has to be integrated. It has to be a holistic view of the person. So that's what we're trying to achieve. And we are, of course, still a work in progress. And I will share with you more about our journey so far. I would like to dive into 3 points. I believe that improving our employees' mental health enables them to, number 1, make better decisions and build better relationships at work. And number 2, this is more often what we hear, of course, improve performance and productivity. Number 3 is, I think, most timely for us in a time of pandemic. It is to help our people, our employees, be more resilient with disruptions and transformation needs. And of course, 2020 was really a year of a lot of disruptions, and we still feel that these days in terms of, the impact of the virus, not just for our employees, but also for our business as well. So, in a nutshell, what was the program that we anchored on in terms of total well-being for our employees? So I can share with you, this is a 5-year-old program. It was launched in 2017, and we call it SM Life program. And it was championed, it was sponsored by none other than Mr. Hans C., our chairman of the board of SM Prime Group. So it's very important that there really is executive sponsorship on well-being programs. Otherwise, it's really not gonna gain traction. So in 2017, it was launched, and it was a fairly simple premise. Try to find ways for people, our employees, to work with a happy heart. That was the very basic thrust of the program. And to share with you, that was also one of the reasons why I got excited to join the company in 2019, when I learned that it offered this kind of program. And during the interview, I was asked, can you help us evolve this further, pivot it, make it even more relevant? And that really excited me. And the program has three components, or three pillars: purpose, performance, and passion. For purpose, it's all about trying to help our people try to see very clearly the meaning of the work they do. And this is very critical, the why. Why did you sign up to join us? Why do you stay? Or why do you want to leave? Why do you want to transfer? So it's very important, being anchored on the why. And based on my conversations with employees, it really strikes a chord in terms of being mentally also healthy when they know that they are really contributing, and it's clear what they have to do. And then the second one is performance. It's about breaking down barriers in order to achieve optimum performance and productivity. It includes the training programs and all that. The third is passion, and it's about trying to match the people with the work which would make their hearts sing. The work which they're good at and which the company or the business needs them to do. Now, to help give you a little bit more context into the SM Life program, so I'd like to share with you how we do it, some flagship programs that we're doing under it. First is for purpose. Especially during a time of pandemic, it was a decision of the president to communicate even more. So, with all of the uncertainties brought about by the pandemic, we had to make sure people knew what was happening. And we were not sugarcoating things. It was to help them really understand that the company tries to give them the real score, so that we understand what we need to do together. So there are candid coffee, town halls, huddles, and check-ins. But these broad strokes are not enough. As I said a while ago, it has to have a personal component. And therefore, we've also been championing the power of one-on-one communication. And we really asked that. In fact, we rolled out a coaching program where we talked about when we do coaching, we don't tell the people that the only agenda we can discuss here is your work. Because we understand that the coachee, the individual, is a whole, an integrated person. So what problems happen at home can impact on the job. And on the flip side, the trials and tribulations of your job will also impact how effective you are as a parent, as a family member, as a wife, or as a mother. So the second is performance. And it's about trying to also come up with psychological safety for our people. Our business is brick and mortar primarily. While we launch SMOs online, the majority of our business still relies on our brick and mortar physical malls. So our people have to go to work. Even during lockdown, we had to go to work so that we can support the essential establishments or our tenants for supermarkets, pharmacies, and the banks. And of course, during a time when there was no vaccines yet, our employees really felt anxious that they will go to work physically and then they may bring home the virus to their homes, to their loved ones. So the first order of the day is to find out what is really plaguing the hearts and minds of our people. And for last year, it was trying to make them feel safe enough to go to the physical malls. Because we cannot advocate safe malling for our customers if our employees themselves first don't feel safe. So we did, a lot of communication programs tackling that so that they would feel safe, that we've done everything we can in order to keep the safety and health protocols in check. But that is not enough, because in a period of a lot of changes, the business had to evolve. And that's why mental health and the total well-being is a business decision, because as the business evolves, as the customer's needs evolve, so does the organizations. So do also the jobs of the people. And so the learning never stops, because we need to help our people really understand how is the job evolving. There were new competencies evolving, new jobs being formed, and old jobs being expanded into transformed versions, new ones for the new reality. So, blended L&D, we were able to cover 98% of our population in terms of training coverage by the end of 2020, despite it being a disrupted year. For the last pillar, I can share with you, in terms of total well-being, we have what we call 360 degrees wellness programs. And again, it covers mind, body, and spirit. Things like nutrition, things like how to have better sleep were also included. And then the other aspect or main program for passion is in matching. And a lot of the jobs last year was either expanded or repurposed. So talent matching and talent repurposing, which is very, very difficult to do and very anxiety-ridden because it's so full of change. Now, what I would like to also share, as I mentioned a while ago, is SM Life is a 5-year program, and it continuously evolved. So I would like to show you a snapshot in terms of the 5-year journey, where we started first in 2017. I wasn't there yet. We started with life balance workshops, because it also dealt with, concerns about being overworked, being very tired, and so we had life balance workshops. By 2018, the culture workshops were rolled out to the rest of the employees, and also the SM Life app catering to employees only was launched. By 2019, I was already with the company, and it is where I really tried my best. I worked with our president to introduce and really intensify the awareness on mental health and well-being as part of a total SM Life program. And it's where we introduced Mental Wellness Week, and where we introduced a lot of mental health and wellness learning series. Because it's about continuing what was started in terms of the discovery phase during the culture workshops of the past 2 years. By 2020, of course, with the pandemic and also with the volcanic eruption and also with the earthquakes in Mindanao, what we did was to actually introduce psychological briefing, because I've really felt that it's really more than what HR can handle. In terms of these kind of situation, we need professional help for our people. So we also expanded the HMO coverage of our employees to cover psychological consultation as part of the package. And also it's where we struck up a partnership with Mind You. And then we also did a relaunch of SM Life app, where the health and safety protocols is very much embedded. And 2021, this year, it's all about, I would think, about the self-choice in terms of your daily boost. So we call it Project Spark. And it's very simple and very doable. We send out really thematic tips or boosters on what they have to do every day of the week, including weekends, because our malls are open during the weekend. So I would like to just provide a little bit more information about 2019 and beyond, because it is what I'm most familiar with. I was already with the company. So for 2019, as I mentioned, it's about introducing and really increasing the awareness of mental health in the total SM Life program, the integrated program. And then with the pandemic, we started to really come up and talk about the concept of HR's essential services. So it's not just about, essential stuff that you need to buy, but you have the essential services needed by the employee. And again, this covers including your mental health, consultation, counseling, and then the wellness learning series, so that people can know what is the help available to them. Because one of the main tenets is people have to help themselves. So we have to provide the resources But the decision, the drive, has to be from the person. It's a personal choice. So that was what we tried to really emphasize 2019 until 2021, even beyond. So 2020 was really a period or a year of disruptions, pivots, and transformation. I mentioned about the transformation agenda as we digitalize our processes and really even launch SMOs online for our customers. And the help we provided is actually to help people cope with the rapid changes and inspire them to find fulfillment in what they do by providing holistic well-being program. But first and foremost, we had to understand what were the thoughts plaguing the minds of our people in 2020 until now, and then until beginning of 2021. So top of mind questions included the things which troubled their hearts, and these were discussed even during the ManCom meetings. You know, things like people asking, what is the future of this company? What is my future in this company? How do I cope? What is the meaning of all of these changes? Why is my job being expanded? Why am I being repurposed? And then for the leaders, they would also tend to ask, if I myself have some anxieties, how do I inspire my people? And then for some, they also, of course, tend to ask the popular question, is it okay not to be okay on some days at work? So my realization here is it's very important for the company and for the leaders to talk about these things. And in my conversation also with some of the leaders, our division heads, they actually talked to me about mental health concerns. I have someone, they would say, an employee, and they would describe. So we would find ways to actually help that person. We won't give up on our people. So with all of the questions being raised to us, and we understand the feeling, the anxiety, we try to diagnose that, the organizational diagnosis of it. I was also thinking together with my team, but HR had to offer something differently. Because while we are there for them, the immediate heads are there for them, we need to give something different. Because I do not want to reach a point where we would face ourselves with the cost of doing nothing, the cost of doing nothing differently in the times when emotions are running high and people need help the most. So I would like to give you two examples. Two examples of real-life anecdotes, and we just call them Employee A and Employee B. And these are two people that I personally monitored or really made sure that I am keeping track of what's happening to them. Employee A was hired, generally new in the company, very good technically, but has extreme emotional periods in her work or even at home. So we had to find a job for her and to match her with an immediate head who can really understand how to deal with that kind of person, that kind of situation. Because we believe that we don't give up on her. And I'm happy to say that the person has transferred in terms of the job and is actually doing well with relatively very stable moments on the job. And the second one is someone who's been with the company for a long time, 8 years already. And then because there were transformations left and right, digitalization agenda, of course, he found himself trying to grapple with a lot of new things. And he felt like he couldn't live up to it. Or he was very good with the old ways of working, but he felt lost and inadequate with the new environment. So again, we did not give up on this person. And he was very good. But he really lost weight. He withdrew from the people. No longer did he give, his usual jokes. We really saw the shift in the personality. But with really targeted counseling sessions and coaching session, and including mentoring to help the person really match the pace of the new environment, we were able to help him get back on track. So he was able to bounce back, regain his weight, his health, and he was able to be back in terms of his leadership capabilities. So these are two very concrete examples that I really know about. And it helped me really underscore the importance of finding ways, very targeted and personal ways to help our people, our employees. Now, as I mentioned, it can't just be about our internal resources or HR or our leaders. We have to find help also. So I tried to ask my team to find a partner, and it's where we struck up a partnership with Mind You. And this is where also it becomes a business decision, because we signed up on a contract with a new supplier or vendor, a partner like Mind You, during the height of the pandemic, where business was not doing as well. It has to be a question that is strategic. And I really prepared my heart when I was talking to the president, asking him to invest an additional budget on an additional program, which some people may see as nice to have. But I'm also very thankful of the trust given by our president so that we can strike up this partnership with Mind You. And you know what he told me? He said, Cheryll, I do believe mental health is real. So it really is not just an HR decision. It is, at the end of the day, a business decision. That when you have a transformation agenda for the business, at the heart of it is the people agenda. There's no transformation agenda without the people agenda. And then, in terms of employee feedback, as HR, we have no visibility about who avails of this program with Mind You, because we understand and respect confidentiality. But what I get as anonymous feedback is about really appreciation of being heard without judgment, of having someone to talk to, because there are times when someone here actually gave a feedback that is the first time out of the year of turbulent year that he or she was able to share his thoughts to someone without judgment. So, what do our numbers tell us? And I'm closing already in terms of the numbers. Erasing the stigma of mental health care in the workplace. What do our numbers show? 20% participation in the Mind You program. And some of you may wonder, is 20% a good number? Well, coming from a situation where it wasn't talked about before, where mental health wasn't the concept discussed very openly or really campaigned in the company, I believe 20% is a solid number. That's 1,000 employees gaining access to professional, unlimited, and confidential counseling sessions when they need it the most. So I think it's a solid number for our people. With 60% also booking completed, and with the program, the mental health awareness as part of the SM Life program, 100% communicated. I don't think there's anyone in the company right now who would not know that we are championing mental health or we offer our Mind You services to our employees. And then it all circles back, of course, what's the business impact? And it may be hard to quantify, but I view it really as part of the retention and overall performance level of the people. And despite, there's a phenomenon right now in the world called the Great Resignation. A lot of people are resigning. We've had our fair share. Because again, there's no perfect company. And we are a work in progress. But we were able to retain 90% of our high potential talents, of our critical talents, despite the crisis, despite all the transformation left and right. And that's actually a global benchmark, 90%. Retention rate of high potential talents. And then second is 10% of our population of our jobs have been repurposed. And again, it's very hard, trying to grapple with new things, untried things, when it can be very unstable in terms of an environment. But 10% of our jobs were repurposed for transformation. And I don't think these numbers would have been achieved if we did not offer, as much as we can, a total well-being program for our employees. And in general, we also saw a reduction in terms of attrition caused by culture fit. So, that's the end of my sharing for this afternoon. And I would like to take this opportunity to give a shout out to our HR teams across the malls all over the country who are advocates of total well-being. And we will continue to be a work in progress because I believe that life and well-being is a continuous process of discovery, learning, and growth. Thank you and good afternoon.
Nice. Moving on to the next part of our program, let's get to know more about the idea of presenteeism and the psychometric insights MindU has uncovered about it. Let's welcome to the stage MindU's Head of Operations, Mr. Miguel Valdez.
Hello. Hi, thank you so much for the introduction. So good afternoon. I want to thank Ms. Cheryll for sharing the insights that she gave, because I think she's going to enjoy the presentation that I'm going to be giving today. All right. So can we move to the first slide, please? Okay, so the topic that I will be discussing today is the price of presenteeism and computing for the cost of poor mental health in a corporate setting. MindU has been almost a year plus in existence, and we're currently taking care of almost 25,000 users, right? Providing them with quality and efficient mental health counseling services. The goal of MindU is to create happier, healthier, and more productive employees, all right? And we do this by integrating technology, okay? Integrating technology, creating an infrastructure that can give access to mental health counseling to everyone in an organization, from the top all the way to the bottom. Another aspect of how we try to meet this promise of more productive and happier employees, of course, is education and the involvement of upper management, middle management, all the way down the organizational ladder. Another thing, of course, would be we equip the new mental health professionals in doing their job more effectively, and we engage in education for the employees so that they are fully aware of, mental health concepts and things like that. Now, presenteeism, next slide please. Presenteeism is the manifestation, all right, of personal problems of the employee. So there are two aspects in the work in the work context that often trigger poor performance, or it's a manifestation of poor mental health, poor organizational structure, and so on and so forth, which is absenteeism and presenteeism. So to give you an example of presenteeism, has there ever been a time when you catch yourself at work just scrolling through Facebook? It would look like procrastination on your part, but that is a manifestation of presenteeism. You are potentially feeling burned out. You're potentially feeling overused, okay? You have other issues occurring in your life that is distracting you from performing your duties, right? That would be, if you've experienced that in your life, that would be presenteeism. Absenteeism, of course, is fairly easier to track. It is basically employees going on leave without any actual good reason, all right? They just need a break. So that's easy to track. How often did they avail of a vacation leave or a sick leave? But presenteeism is basically the employee is there out of compulsion, out of requirement. They're physically there, but they're mentally not present. No work is done, okay? And in this slide that you see is the basic definition of presenteeism. You have being physically present at work, but mentally elsewhere. You have an experience of decreased productivity. People also who are not physically or mentally present as well make more mistakes. They tend to be careless in terms of their work. They rush things through. Of course, prolonged experience of presenteeism, of course, will potentially lead to burnout or job dissatisfaction. All right. So the major contributions that a lot of the research shows with regard to presenteeism is poor mental health and poor work health, right? So this is the main crux of what Mind You is trying to decipher and solve for our clients. How do we decipher the components of presenteeism? And how do we address that with the programs and services and policies that we provide our clients? Next slide, please. Okay, so our research shows, all right, after administering an employee mental health survey or check, we were able to decipher from the data. And this is, I would like to remind the audience that this is preliminary findings, so this will go through another layer of statistical analysis. However, we are quite pleased to be able to determine that presenteeism, at least for this particular data set, okay, it shows that 30% of presenteeism is composed of poor work health. Poor work health would be basically poor employee engagement, poor organizational culture, and poor supervisory relationships. So the infrastructure in the organization's failure to implement effective policies contributes to about 30% of presenteeism. However, based on our data, we are more or less able to determine that almost 40 to 50% is contributed to poor mental health, right? Just to give you an idea of how mental health would manifest in a regular employee, depression has a tricky way of how it manifests in people. Depression hides your positive memories from you. When you're in a depressed state and somebody always says, think of something positive that happened in your life. Even if you recall it, or even if you try to recall it, you can't. Because the emotion, the disease blocks your ability to recall these things. Because our memories are often tied to emotions. And if you're feeling down, how can you suddenly feel positive? Okay? Next slide, please. So this is another data set with a sample of 500 employees. And again, as I mentioned, anxiety symptoms, stress symptoms, and depressive symptoms contribute to around 40 to 50% of presenteeism. So if you are able to create and implement an effective mental health counseling policy and service, there is a level of confidence that presenteeism will go down because you equip your employees to better address these mental health concerns. You give them the tools to bounce back faster, all right? And in this particular case, the organizational structure of this data set contributed to about 20%. So the numbers vary, and our total preliminary research shows that we are fairly confident that presenteeism is composed of these four things. There is that black section there, which is basically unknown components that we feel that could be other areas of the organization that could be unique to the context. It might be a BPO, it might be a bank, it might be something, all right? And we will go through the data further to determine those things, all right? But with the current findings that we have, if a client or an organization were to invest in good work health policies, specifically organizational culture, employee engagement, and supervisory relationships, as well as mental health counseling, we can address almost 70% of presenteeism. All right? And this is the interesting part that I think our audience and even our clients who are paying attention and watching this would be of interest. Next slide, please. The combined loss of revenue for absenteeism and presenteeism for these case studies are listed above. And this is a very conservative prediction of about 15% of the population experiencing the mental health problems. So for the data set of 1,000, the company is losing almost 2.5 million worth of revenue because employees are experiencing presenteeism. The employee is not being given access or tools to aid in the quick recovery from their mental health problems, right? And of course, additionally, the organization has poor structures or processes that contribute to that as well. And data set number 2 of 500, that is almost 1.5 to 1.6 or 1.4 million pesos loss of revenue if they choose to ignore implementing mental health policies and services to the company. This is the number, and this is the basic formula that a lot of the organizations are looking for. They want to see that the mental health services and the changes that they're trying to implement actually affects the bottom line. And the truth is, it is. The data is already pointing to that direction. Maintain your people. Okay, so in the next slide, which is qualitative insights. Again, this is preliminary data. This will go through further cleaning and verification. But for a qualitative insights, we notice that there is an inverse relationship between poor work health and presenteeism. All right? Individuals 25 to 34 displayed a moderately strong inverse relationship with poor work health. It also showed that women tend to report depressive symptoms more frequently than men. About 40 to 45% of presenteeism is influenced by poor mental health in both data sets. And we have a theory that simply addressing mental health in the workplace is significant enough to potentially decrease presenteeism. So for those potential interested organizations, even if you don't have the company policies established yet, but you do implement the mental health counseling services, you can actually save a significant amount of your revenue by just implementing this, almost 40%. Again, however, to create a true cultural change, all right, you need to get management involved, all right? It's not simply as easy as, taking mind you and we'll fix it, no. The executive level, the middle management has to participate. They have to be equipped and they have to understand the overall impact of the program. Because only then will the intervention be sustainable. Because as all of you know here, if you have a mental health problem, one session is not enough, okay? You need a constant supply of support through time. Okay, so next slide, please. So moving forward, one of the questions that the team has been, trying to expand or add to our analysis, of course, would be if there is a difference between men and women, a very clear and statistical difference in terms of their age group, in terms of the reported mental health problems. To introduce other mental health concerns, but not limited to adjustment disorder and bipolar disorders, right? We would like to also control for other influencing factors such as financial standing, position in the company, and of course educational attainment. These would be the types of data that we want to know. If your education has an influence to how you address mental health counseling and needs and self-care. Of course, determine the effectiveness of various organizational culture strategies to address mental health symptoms, such as psychological safety. Determine the influence of supervisory relationships. So one of our data also showed that one of the big influencers for poor mental health was that the supervisors don't know how to communicate empathically with their team, right? And it's very important that that they understand that they are, even though their rank is different, but they are all employees all together. That is one of the mindsets that we try to espouse in the next steps. And of course, employee engagement. How does the organization motivate their staff? How does the organization share their values with their team? How does the management live the values? All right. Because once the employee has that connection once the employee realizes that, yes, management does believe all the values that they are saying, it becomes easier for the employee to start to live by that, right? So again, these are all preliminary data. However, it does prove one thing, that mental health is a big contributor. Addressing mental health is a big contributor to making your company, a safer and more productive place. So thank you very much, and I hope you were able to take some insight from this discussion.
All right, let's get the conversations rolling. Let me introduce you to our next speaker for today. She is the resident psychiatrist at the University of the Philippines Health Service in UP Diliman, and the Mental Health Science Flagship Program leader of the Ateneo School of Medicine and Public Health Center for Research and Innovation. Her passion for mental health extends beyond campus duties. She also runs the Foundation for Advancing Wellness, Instruction, and Talents with her husband. Here to talk about the landscape of public mental health in the Philippines, let's give it up for Dr. Dinah Palmera Nadera.
Thank you. Maraming salamat. Magandang hapon sa ating lahat. Salamat, Ms. Reyes. Ako yung starstruck ngayon. I will present an aspect of public mental health in the Philippines. So it's not going to be very extensive discussion of it, but just to relate it with the pandemic and mental health being our mental capital. So in this talk, I will briefly discuss a public health perspective, I'll just remove this, of mental health, mention some of the effects of the pandemic on mental health on the community at large, and underscore the population mental health as a contributor to national development. Mental health is actually a public health concern. In fact, the Sustainable Development Goals mentions that the promotion and protection of mental health is one way to actually decrease deaths, the burden of non-communicable diseases. It is vital to public health, and mental well-being is very important in the improvement and upliftment of the quality of life and the capacity to cope with life's challenges. It is also protective against physical diseases, social inequalities, and unhealthy lifestyles. So public mental health is about promoting and protecting our mental capital, with emphasis on the phrase mental capital, and mental health and emotional well-being. And it is also, as mentioned a while ago, uplifting quality of life, and again, emphasis through organized efforts of society. So in the definition of public mental health, we emphasize two things. We talk about mental capital, and we talk about protecting this mental capital through government efforts. So in the definition of public mental health, as I said, mental capital is, is emphasized. And what does mental capital encompass? It includes cognitive abilities, flexibility, emotional well-being, skills, resilience, productivity, and also the ability to contribute effectively to society. So we talk of productivity not just at the individual level, but also productivity that contributes to community and to humanity at large. So in Filipino, mental capital is yamang isip. So the translation of mental health is lusog isip. Lusog isip ay yamang isip. And it encompasses galing at gilas, kakayahang matuto, kakayahang umangkop, pagiging matatag, pakikipagkapwa, and lastly, pag-ambag sa lipunan. So prior to COVID-19, we know from literature that about half of the world's children, by the age of, about half of all the mental health conditions would have started at the age of 14. And about 1 in 5 of the world's children actually have a mental disorder. So you can just imagine the impact of suspension of classes, the closure of universities on a massive population of youth. And if we talk about depression, which is something that has been spoken about since this morning, literature also says that about 300 million people all over the world are affected by depression. And 1 in 20 persons actually would receive quality care for depression. So what about the 19 people? So they don't receive care. But we know that the pandemic has changed all of that. So if there have been disruptions of basic services because of the pandemic, there have also been gains in the use of digital technologies in accessing care. But again, this is not like a fair, this is not like fair to everyone because still there's a digital divide. We still have problems with the internet. So even if we say, yes, digital technology has actually created some access, we could say that still the pandemic has brought about the magnification of this digital divide. So no wonder that in a mental health crisis, it is said that this will continue even after the pandemic. And mental health professionals are very few. You have heard about the data of mental health professionals in the country from the early speakers. So again, let us look at public mental health. So public mental health is population-based. And when we say it's population-based, so the target is not only stopping or is not only focused on the individual level, but the entire community. So the population approach, therefore, would emphasize collective responsibility for mental health, its protection, and prevention of mental distress and disorders. And population mental health, public mental health, also emphasizes the key role of government and the partnerships of all those who contribute to mental health. The government's role, so what is the key role of the government? The government's role is basically directed towards the social and economic determinants of mental health. And the social and economic determinants of mental health are, there's a long list, but the 3 main determinants would be freedom from discrimination and violence, social inclusion, and access to economic resources. That is why violence prevention is very important in the promotion of mental health. We talk about domestic violence that is actually increasing also because of the pandemic, when the families have problems with each other and they're now, at home. We hear about stories of increased abuse of children and women. So in terms of leadership and governance, what has the government done so far, and how is the landscape of public mental health within the health systems and structures? So to name some, we had the mental health policy in 2001. But even before the creation of the mental health policy in 2001, there already have been gains in the promotion of mental health because we are very prone to calamities and disasters. And usually, the disasters and the conflicts, armed conflicts, give rise to the creation of mental health services because there are felt needs because of the impact of the disasters. So aside from mental health policy, we also have community mental health, and as mentioned earlier, mental health and psychosocial support as a key component of mental health in emergencies. There is already a PhilHealth coverage as early as 2010, but limited to 7,800 per case per hospitalization. And there's a medicine access program for mental health in primary care as of 2012. And there is actually a public health approach to drug abuse programs starting in 2016 when Operation Tokhang actually started. And of course, the last win is Republic Act 11086 or the Mental Health Act of the Philippines. So, Mental Health Act of the Philippines, how does it actually address the socio-cultural determinants of mental health? The Mental Health Act is rights-based, okay, and is recovery-oriented. So it's a mix of both public health and human rights approach to the promotion of mental health. It clearly articulates some ways to address freedom from discrimination and violence and social inclusion extending to the labor sector, as we have heard from the previous speakers. But much still needs to be done regarding freedom from discrimination and violence, social inclusion, and access to economic resources. So the implementing rules and regulations of the Mental Health Act was signed 2 years ago, January 22, 2019. And we are just on its third year of implementation. So we understand that while there are key steps, while there are milestones in the implementation of the Mental Health Act, we know that we are still just we are just taking off in terms of its implementation. The COVID-19 pandemic has worsened the determinants. So much has been said about by the earlier speakers about the impact of the pandemic on mental health, particularly at the individual level, and how this also affects the larger community. But beyond individual cases, the pandemic has affected community mental health. The large scale of health crisis, the health crisis that this pandemic has brought has affected the community's, first of all, sense of safety and security. Safety and security, mentioned earlier, is key to making us, to increasing our quality of life. Anyone who doesn't feel safe and secure will be anxious, and it is a leading contributor to anxiety. So social networks have also been affected. Basic services that are very vital, they have been disrupted, and there has been destruction of livelihood. And there are emerging problems, aside from the problems that used to be seen but have actually worsened. There are emerging health problems. For example, there's increasing addiction to some behaviors like gaming. We have seen pornography to be flourishing. And this is all because people are using digital technologies while they are in quarantine or while there's a lockdown. And the other behavior that has also been observed is the emergence of many non-communicable, the other behavior is sedentary lifestyle, which has actually led to a lot of non-communicable diseases. And then we have less physical activity, we have less exposure to the sun, knowing that the sunlight actually improves our mood and our immune system. So all of these are emerging conditions that the pandemic has brought us. But safety and security is actually one thing that I would like to emphasize, because even false information aggravates our feeling of being unsafe and feeling of being insecure. Everyone is on a continuum of mental health, from positive well-being to chronic and serious mental illness. And despite the challenges that we are facing, I would like to put a positive note. There is also a recognition that there are sustained investments to grow, to increase our mental capital. at individual and community levels. First of all, the pandemic has allowed the discovery of our capacities and abilities. So some of us have learned how to cook, some of us have learned how to tend to plants, no? Kahit exotic plants. So let us also recognize that the pandemic has allowed us to discover what we can do at an individual level and how resourceful we have become in the face of the normal stresses of life. Some of us are having problems with work boundaries, but many of us have also learned how to handle these boundaries between home and life, home and work. And then strengthening of resilience in the face of extreme life experience is something that we are going to probably recognize later on when faced with other disasters, because this pandemic has given us the opportunity to hone what we Filipinos actually have, tatag, resilience. Creativity and productivity is also something that would contribute positively to the community. And many of us, some examples were mentioned this morning, many of us have been engaged in several creative community activities that also uplift our quality of life. And notice that the things that I'm mentioning are actually concepts that are found in the definition of mental health. Republic Act 11036 defines mental health as a state of well-being where one recognizes his own potentials and capabilities, is able to cope with the normal stresses of life, is resilient in the face of adversities, is productive, and is able to contribute to the community. And basically, even just looking at the values that are embedded in the definition of mental health, it is so universal. Okay. It does not talk, the definition of mental health does not talk about an individual's well-being, but also emphasizes the contribution of this well-being to the community. So just to emphasize, that when we talk of mental health, we're talking of mental capital. Okay? And each person's mental capital contributes to the capital of the family, the barangay, the city, the municipality, the province, the country, and the world. So when we talk of public mental health, we now recognize mental health as a global public good that we need to access, because it is our right to have good mental health, because we have the right to health, therefore we have the right to mental health. Mental health problems have risen in the context of major demographic, environmental, social, and political transitions, including the transitions that are brought about by this pandemic. And what we need to do really is to protect our minds. No? We have to talk about brain health. We have to have good sleep hygiene. We have to talk our mind and our brain because it is our capital. This is the capital which actually contributes to national development. So let me just say that investing in population mental health is investing in national development. Ang ating utak, ang ating isip, ang ating lusog isip ay yamang isip. Kailangan natin itong alagaan at pahalagahan. Maraming salamat.
I hope everyone is learning a lot. Certainly I am. So we'll also be talking about MindU's exciting partnership with the Australian government via the Business Partnerships platform and the future of mental health as we wrap up the National Mental Health Summit. But first, we will be taking another 15-minute break. So don't go anywhere, guys, and we will be back shortly. All right. Welcome back again, everyone. We've now reached that point in the program where we will be answering questions from our audience. So thank you to everyone who has sent in their questions. Please do not hesitate to drop more cues over Kumu, YouTube, and Facebook. First, let's welcome to the stage Mind U's Chief Strategy Officer, Michael J. Needham, who will be moderating the discussion, and Mind You Senior Psychologist, Celine is also here to join the esteemed panel. Also here is President of Vanguard Assessment, Mr. Miguel Valdez. Joining them is a face we've also met earlier. Let's welcome back to the stage Dr. Dinah Palmera Nadera.
Hello, can you guys hear me okay? Okay. First of all, huge thank you again to everyone here today. Thank you so much for participating in what I hope is the first of many mental health summits to come. These discussions are great to be having. I've really found it fascinating, at least personally, listening to everyone so far. So really excited. Thank you all. Actually, we've got 3 people who've already spoken, so thank you to the 3 of you and the rest of the speakers as well as to everyone watching and sharing at home. We really, really do appreciate your participation. This is a team effort. I'm really excited. I've been talking to you guys beforehand. I hope this is going to be a fruitful panel discussion. We've had questions sent in via Kumu, YouTube, Facebook, as well as via our website, so we'll try and get through as many of them as we can. We have 3 of the brightest minds as it pertains to mental health in the Philippines. And I'd like you all to please, if you could, introduce yourself. We'll start with Miguel.
Yes, teacher. Okay. My name is Miguel Valdez. I am the CEO of Vanguard Assessments. Our company specializes in psychological profiling and psychometric assessment. We service around 100 plus private entities and about 30 plus government agencies as well. So thank you for having me here.
No worries. Thank you, Miguel. And Doctora, if you could introduce yourself.
Hi, I'm Dinah Nadera. I'm a part-time psychiatrist at the University of the Philippines, Diliman. Lone psychiatrist for now. I hope I will have someone to join me in the next years to come. And I am also a adjunct faculty at the Ateneo School of Medicine and Public Health, assigned under the Center for Research and Innovation.
And lastly, well, I know you very well, but if you could introduce yourself to everyone else, please.
Yes, hi Michael. Hi everyone, good afternoon. I'm Celine. I'm the Senior Psychologist at Mind You Mental Health Systems, and I'm also the Chief Psychologist at Pasig City Cheryll Hospital. Thank you and welcome.
Okay, let's begin. So we have about 40 minutes, probably 38 now, looking at the time, to get through as many of these as we can. We will try and get through all of them, though there have been a lot sent in. I'm going to start with a very open-ended one. Just give me, in a brief, let's say, minute or 2, your overall assessment on the general state of mental health here in the Philippines. So would anyone like to go first? Otherwise, ladies first, yes, okay. Rhea.
Or respect your elders first.
Okay, that's possible.
Yeah, we're coming from different decades here, huh? Yeah, well, I volunteered first because this was the topic last Friday at the DOH's Mental Health Summit also, no? So I would describe mental health in the Philippines as developing. And I think it is hopeful. We have a long way to go, but I would like to believe it is developing.
I agree with Doc, just because when the pandemic happened, it's a natural flow of inquiries with mental health challenges. Pre-pandemic, it was harder to convince a person to seek help from a psychologist or a psychiatrist. But what the pandemic somehow has brought to us is the awareness that, hey, mental health issues are real and it has to be addressed. So it's developing more so with the youth. They're more vocal, and hopefully we'll be raising a generation of people who has, mental health care at the forefront of their lives.
In Southeast Asia, I think the Philippines is one of the first, at least in the Southeast Asian countries, we're one of the first countries to have a mental health law and a licensing law for practicing psychologists. So in that context, we're very far ahead. But with relation to the pandemic, I think it forced private organizations and public organizations into a corner to recognize the impact of mental health. So there's an opportunity here for it really to take center stage, to lift the quality of life.
Okay, yeah, okay, great. So next question, this one was actually sent in anonymously. Now, a big topic discussed here was the under-provision of licensed psychologists and psychiatrists in the country. I think our ratio falls about 20 times below the recommended standard by the World Health Organization. And so, in line with that, the first question was, how would I know if I'm already suffering from a mental health issue if I'm not able to consult a professional, which sadly may be the case for many people. I know, Doctora, this might be a good chance to tell them about the on-the-ground work you were doing. But the question first would be, how would I know if I'm suffering from a mental health issue if I'm not able to consult a professional psychologist, psychiatrist, a doctor of any kind?
Okay. Well, first, we have to be very familiar talaga with the definition of mental health. I will anchor my answer on that. So, a person with good mental health knows his or her own abilities, can cope with the normal stresses of life, productive, fruitful, contribute to society, resilient. So if you have all of those, then okay, you have a good mental health. But it doesn't mean also that if you don't have any one of those, one or all of those, you already have poor mental health. I think the key there is productivity. As human beings, that is our nature as human beings. We are not only reproductive, we are productive, di ba? So, when one loses that productivity, that sense of purpose, that meaning, then I think mental health is, the mental health is really starting to be in question. But it does not mean also that you already have a mental disorder.
Of course, we want to avoid encouraging people to self-diagnose. I mean, there's the old chestnut of typing in some symptoms and WebMD, and then you read it, and oh my gosh, I'm going to die. So, yeah, do avoid self-diagnosis where possible. Rhea?
Generally, if there's a change in behavior, your sleeping patterns, your eating habits, that would indicate that the person might be experiencing a crisis. And crisis is part of our lives. However, if it exceeds your capacity to cope at that time, it might progress to a mental health challenge or condition. So the indicators would be, there's a mind-body connection. So if you're developing anxiety, then you need to be aware of your bodily signs and symptoms. So it could be being nervous, and this will escalate if it's not handled accordingly. So any change of behavior, plus you have to listen to your body, because there's really a connection between how we think, how we feel, and how we act.
I'm not going to answer it in a academic or scientific way. I think my answer is going to be more based on the human experience. And I think the moment you start feeling desperation, that can be tied to physical health, that can be tied to your mental health. But, a lot of these people don't have a background in psychology, they don't understand the concept, so they will relate more to the emotion. And I guess the most common emotion for people who are already at this point is they start getting desperate. And of course, when you're desperate, you start taking more risks, and you start behaving in more extreme behaviors, okay? So I think desperation would be a good emotion to be mindful of if you want to know that you're experiencing a mental health symptom.
Yeah, I think you all make extremely valid points there. And I guess following on from that, a big reason why people might not be able to access a professional is the cost. And I know we were talking earlier at the table, psychology sessions can go anywhere from $2,500 up to, I've actually paid $4,500 before. I don't know if that's because I'm a foreigner or if that's just the regular price. And it can be quite expensive, let's be realistic. For the average Filipino, I think the median income is around 18,000 pesos. So
Can compete with food.
yes.
It has to be
Yeah.
food.
So I guess my question would be, why is there a disparity between the cost of psychological care? This summarizes quite a few questions here where they're saying, how do I get professional help when I can't afford it? So we'll do it in reverse age order.
Oh.
I think that's you.
Well, there's some Miss Universe questions. I think that psychology as a field is, in terms of the priority of profession, is secondary, okay, to overall productivity of the economy. So naturally, doctors, lawyers, engineers, which are the top 3 careers, would be key for a third world economy to build and scale, right? You need those particular skills. And psychology, counseling, all these other things can only grow once that initial foundation, infrastructure, ecosystem of economy, finance, and all that stuff is addressed. And we're at that point. We have an overabundance of lawyers and so on and so forth. And we're still building to move psychology into that same position where it is now a vital component of everyday life, okay? And since that infrastructure has not been built, there is no, like the government is only starting recently, they're only moving things now, they're still trying to understand, how can we guarantee that there's going to be a return of investment in terms of the well-being of the employees, or the Filipinos. How can we know that things are getting better, And it's a painful learning process because there's going to be many programs that are going to start and fail. And that would be why it's particularly expensive. The profession is still finding its footing in terms of where they are in the infrastructure.
To add to that, the scarcity of mental health practitioners and limited access also increases the cost of mental health. Currently, in my talk, I was saying there are only 1,451 registered psychologists. And I was very curious, so when I sat with Doc, she said there are only around 620 psychiatrists. So if a registered psychologist, that would be 1 registered psychologist per 100,000 Filipinos. I don't know how I will take care of 100,000 Filipinos on my own. And that would still be lesser with psychiatrists. So in the long term, we need to encourage people to take up those courses and become psychologists and psychiatrists.
I just would like to bring a different point of view when we talk mental health professionals. Again, I refer to the law because I am an advocate of public mental health and I would like the role of the government to be highlighted. So if you look at Article 4 of the mental health law, there's a list of definitions. So one definition is a mental health professional. So it includes psychologists, psychiatrists, neurologists, okay, mental health nurses. And then there's another definition on mental health worker. Mental health worker will be any trained mental health advocate. So even a GP, for example, a general practitioner who has been trained on mental health, can actually provide treatment, can assess and treat uncomplicated mental health problems. And then mental health professionals plus mental health workers would also include peer counselors, equals mental health service providers. So I think one reason why it's so expensive, we have not tapped the other service providers. We have not trained barangay health workers to monitor persons who have suicide in the communities. Because that's what we do in the rural areas. We train teachers to spot who is potentially suicidal in class. And that makes the teacher not a mental health professional, but a mental health service provider. And even nutritionists, and even gym instructors, because we know that, exercise actually also increases your endorphins, uplifts your mood. So I think that makes it expensive. Aside from the fact also that there's a lot of investment when you study medicine and psychology.
So perhaps you're suggesting a more of an interdisciplinary approach when it comes to training, let's say teachers, educating them on things like mental health. Yes, Miguel, sorry.
Just to clarify my idea, I think it's from my perspective, it's a matter of incentive, right? The demand is only increasing now, and the supply of psychologists and psychiatrists is really low. Okay, and the incentive to be a psychologist financially needs to improve. Okay, because a lot of the people who actually do it because they love it. Okay, I've asked many professors, is it worth? Like when I was going through my master's in clinical psych. Is it worth it being a psychologist? And then his answer was, if you love it, yes. Implying that there was no or very limited financial incentive for people to become psychologists, to embrace this profession and career. And that's where I'm coming from. I would like, insurance companies, I want hospitals, I want schools, I want the government to encourage people to just go deep into the career and do that specifically, rather than having to juggle different things.
Yeah, Reyes, did you have anything to add to that before I move on? Or
It reminded me of mind use approach is preventative. So what Doc was saying a while ago is to train people in communities to have this first line of awareness and defense, so that we could find, like, let's say, a method or a structure to elevate. But on the ground, we could prevent a lot of things. Yeah. So it's really a team of people being more conscious about mental health and looking at signs and symptoms and helping each other. And that's preventative mental health care. And of course, that is what Mind You advocates as well.
So, Doctora, we've got some questions here about the cost of medication. And we had a very interesting back and forth over lunch where you were telling me about actually the availability of subsidized or, should I say, cheaper medications. Could you maybe explain to the audience and the people watching at home a bit about those programs you're working on in Zamboanga and the more rural areas?
Yeah, I'll probably just share my experience with regards to access to medication. So one of the things that we do is to train rural health physicians. So these are the municipal health officers in the different rural health units in several provinces in the country. And when a rural health physician has been trained on mental health, we call this the Mental Health Gap Action Program, the rural health unit actually can become an access site for the Medicine Access Program. Now, what does it mean if you are an access site? If you are an access site, you can request for medications from the Department of Health that you can give to your clients for free. Okay, so there is such a program. Of course, we had those days when we enjoyed that program. It benefited a lot of patients, but the problem again is sustainability. So after a year of supply, then you have a year, parang El Nino tsaka La Nina. You have a year of La Nina and then you have a year of El Nino. You can't find medicines elsewhere. So that's the disadvantage. But there are medicines also in government hospitals. And the recent study that we did at the Ateneo School of Medicine is that found out that the difference between the price in a government hospital and the price in a leading drugstore is between 5% to 800%. For example, there was this one medicine which cost 2.5 pesos in a government facility. Sa leading drugstore, it was between 10 to 12 pesos. The same brand.
Wow. So 6 or 7 times the price of of the actual medication. Okay. Okay, we've got a question here from Erica Latayan. Thank you for sending this one in. I've had this question before, but it's, yeah, I guess this is more for Rhea and Doctora. How can I speak to and help someone, a friend, family member, whomever, with a mental health problem like depression or anxiety?
Maybe I'll ask Rhea to answer that. I'll go for psychological first aid. Basic principles of look, listen, and link. But maybe Rhea can give more explanation. Sorry,
That's also accurate, Doc. However, we have to be conscious also on our own biases. Sometimes we tend to react right away and say, alam mo, eto ginawa ko dyan eh. Or they give advice right away. Now, if a person is in a crisis, you have heightened emotions and you're not thinking rationally. It's the amygdala that's, buzzing. So if you could do reflective listening, really hearing their own version of their story, and that's valid, that's their narrative, then we are not invalidating the person who's in a crisis. So I think we need to also study emotions. It's not being, I'm not sure if this is the right thing, but in school, it's not really targeted, like studying emotions. If you want to be good in math, you study math. If you want to be good in science, you study science. But if you want to know yourself, you know your emotions, you have to study them. Because sometimes you have conflicting emotions. You could be angry but hopeful. You could be sad but frustrated. So we have to get to know ourselves in that level. And so if we are the ones hearing a person out, you need to suspend your own judgment, your cognitive biases, and let them tell their own narrative. Because that would help lower the heightened emotions. And when it's lowered, then that's the time they could think more rationally. That's where you would apply, can I link this person to a psychologist, a psychiatrist? Would they just need a place to vent out? So that's where you apply your psychological first aid.
I'm gonna break that down a little bit more, because I do agree. There was a study that they did where they compared the different types of psychotherapeutic techniques in terms of their success and efficacy with addressing depression. And after controlling for all the variables, it turns out that it wasn't the technique itself, but it was the person. It was the psychologist. It was that humanity that they showed to the patient that was the catalyst for the change. Because this person who could be experiencing different things is whether or not their ideas are irrational, not rational, but this person accepted me. So the possibility of an honest, sincere, supportive relationship is created. Now, for people who have family members who have like this, I'm not saying be their therapist, absolutely not, that's a no. But you need to show that support, that affection, that acceptance. And then naturally, you also have to have the sense to also accept the fact that you can't fix their problems for them, and that you really need to move them to a mental health professional to address that. But being, exactly what Reyes said, you listen to them sincerely, be supportive, be honest, be genuine, would be the initial response, at least, to being supportive to somebody with a mental health problem.
Banggitin ko lang, no? Actually, it was a circle, parang nag-connect lahat, because that is the exact definition of psychological first aid. Psychological first aid is providing humane, compassionate, supportive help to a person who is in need at that point in time. And the important thing is the practical help. So many of us, sometimes we think, ay, mabigat na pag-usapan yan kasi it's emotional. But we need to look at what is the practical help that this person actually needs at this point in time.
And everyone could administer psychological first aid. You don't have to be a psychologist to do that.
Absolutely. Okay, so we've gone granular with that question, talking about specific cases, specific advice. I want to zoom out slightly. Now, obviously, the theme of this summit is to #end the stigma here in the Philippines. I want to go a little bit deeper into that and kind of explore the layers behind that. I'll start with a more open-ended question before we get into a more layered discussion, but why do you think it is we are facing the type of stigma that we're facing towards mental health here in the Philippines? I think we all agree it's better than it was a few years ago, but it's very much still there. Even as recently as yesterday, I was hearing, "Oh, she needs a therapist." That's a joke, you know. And actually, one quote I wanted to point out from Mayor Belmonte that I really liked was, "One day I hope going to see a professional, going to see therapy, is seen as a sign of strength rather than a sign of weakness." And I think that's definitely a target we can aim towards. But yeah, I would just like to ask, why is there such a prevalent stigma? We'll go with...
I'll go first.
Okay, volunteer.
When we talk about stigma, it happens because we have a lack of understanding of a certain thing, of a certain concept. Therefore, we look at it in a different way, and we attach a stigma into it. And the behavior that results from the stigma is discrimination. So stigma is to the thought and understanding, discrimination to the behavior. So if we are experiencing a lot of stigma and discrimination, it's because we don't understand it in its entirety, in its reality. Just like the LGBT lecture this morning, there was a lot of new concepts for me, and I had a wider understanding. And of course, that actually lessens the stigma and discrimination. So yun.
Yeah, I agree. Rhea or Miguel?
We are brought up in a certain way, and I think because we have strong values, we sometimes enforce it to other people. So we have to be conscious to respect and accept. So with stigma comes correct lack of education. So that's why we have to keep on talking about these things. Sometimes our tendency as Filipinos is not to talk about something embarrassing or something that would hurt someone's feelings, but it's this honest conversations that would educate both of us. Same like in the times of the Greek, like Plato, they just have a dialogue, right? We have to bring back those open conversations and learn from each other.
I have something a little different, but maybe it's connected. We're from Southeast Asia. We're a collectivist society, more or less. I believe that our culture, and I'm gonna try to go granular here, we have like a social identity that we are not aware that it's important to us. Okay, so part of how we see ourselves is part of how we see ourselves in relation to others. Okay, I imagine in the West, my identity of me would be more important versus what other people think of me. But here in the Philippines, our identity is partly relationship, the people that we have relationships with.
Externally sourced.
Yeah. So I think as a culture, we haven't realized to prioritize the need for self-care for myself. And so there is a need, a somewhat irrational need in the very extreme end to satisfy that social identity. So people don't want other people to know that I'm seeing a therapist. People don't want other people to know that I'm weak. Okay, and this is not something that was imposed on them per se, but this is something that they carry with themselves as they operate within our culture.
But there's a balancing act to that, right? Because whilst yes, maybe there's more of an external source of identity, we have a collectivist mentality. Asian culture as a whole, not just the Philippines, the building blocks of society are very familial, right? It's based on family.
True.
As kind of the building blocks. And those families, I guess, typically act as support systems as well.
True.
So there's a balance between how much is my, individualistic self that I'm putting towards my own identity versus, not wanting to scrap all together those positive values that can come from a collectivist.
Sure, I'm not
identity.
saying that it's something toxic, because it is good having such strong ties to your relationships. Especially if it's a healthy one, you will survive a lot of trauma and stress when you have these kinds of strong relationships. It is when, it becomes excessive, controlling, dictating, that it becomes a problem.
Sure, that's great. Thank you. Okay, we have a couple questions from Mariella. Mariella, thank you for sending this in. This is now, I guess, a bit more topical towards the COVID-19 pandemic. I'm sure you guys have heard of it. The question is, how do we stay motivated and productive in a work-from-home setup? So obviously, most of the working society has now shifted to a work-from-home setup. How or what advice would you have to them in order to stay productive despite this radical shift in their lifestyle?
You need to create boundaries between work and home. With the work from home setup, your initial safe place, which is the home, is now already your work area. So sometimes it's confusing. And I hope that a lot of us have adjusted in this new normal. But it's really creating boundaries. For example, this area in my house, this is just my work area. The rest is for where I could have my me time, where I could see my plants. Okay, so it's really a conscious effort, a purposive decision to create boundaries between work and home, despite just being in one place.
But that's kind of difficult for people who don't have enough space.
I agree as well.
Yeah.
Because a lot of Filipinos live in, let's say, a one-room house. So yes.
Because I remember some people asking me, but I don't have space. I mean, I share my room with my sibling. I share my room with my cousin who lives with us. So it makes it difficult for them to really set the boundaries. Kasi yung boundaries, it should be aside from physical, it's also psychological, right? So first you have to work on the physical because that's what you can control. You cannot control the other boundaries because your boss will probably send an email, text you, whatever time it is, doesn't matter. But so it's kind of difficult. Pero if you are creative, you can really create. You can actually make use of technology. Alam mo you know that feature of your Gmail that's a schedule send?
Love it, yeah.
Yep.
Use it all the time.
Works for me.
Yeah. I just love it during the pandemic because sometimes you just have to, be off from that work mode. And then your work mode will be in off office hours. And then you just answer and send it during office hours. And you don't have to rush because you feel that you've done something already at 8 a.m., right? So there are many things, but it depends on your situation. So sorry, but I cannot really answer that in a concrete manner.
Mm-hmm. So maybe they just have to keep on trying. But the ultimate goal here is to find your balance and not just living every day letting it consume you.
First off, I'm a big fan from work from home. In 2019, that was my goal prior to the pandemic. So it was a goal that I wanted to do for my staff because I didn't want them sitting in traffic for 2 hours to get from their home to the office. It's just ridiculous. I mean, the employee will come tired, smelling like smoke, and then they need about 30 minutes to unwind, and then they're just gonna stare at the screen because they're tired. It's not fair. 2 hours going in, 2 hours going back, 4 hours gone. So early on, so I'm pro work from home. However, because I know my staff, I think the answer to how to handle that is really based on your personality. So my marketing team, who are mostly extroverts, demand the human interaction. So if they want to go to the office, they can. I'm not going to stop them because they want to be together. It's of course the fear of the pandemic and getting sick is also preventing that, but they do crave that human connection. Whereas for my staff that are introverts, most of the time they just prefer working from home. Again, it depends, but my basis of the depends, of course, is preference. Yeah. And of course, my team, I've been working with my team for a very long time, so I trust them already at this point. That will only work for people that that have been working with you for a very long time. People who are new, that's a different story because they have to be absorbed into the company culture. They have to understand and build relationships, and that's where work from home is not feasible in terms of a long term because you're not going to be connected to the people. So work from home, yes. For the more senior, more self-aware employees who are trustworthy and capable of exercising what they need and want, go ahead, customize your schedule. For the new staff, unfortunately, we need to build relationships first, so you might have to come in more regularly than the senior staff.
But there's also a gender factor to that.
I think so.
Yeah, di ba? Women actually find it more difficult to set boundaries if they're working from home. So, yeah,
That's true.
It's so difficult to like give us a single answer to that. Women would have problems with this time I'm working on my laptop and then I just turn 90 degrees, I'm cooking. Turn another 90 degrees, I'm doing laundry. So it has several factors.
For reference, my company is 98% female. So that's just my reference. I mean,
Fair enough. I mean, it's not a competition. I think ours is around 85%, 90%, for reference. Okay, so we've got some interesting questions from Thea Sanitza. I probably pronounced your last name wrong. I'm really sorry. But thank you, Thea. So I guess, I suspect she's probably a bit younger. So this would go to younger viewers at home. And the question is, how do I talk to my parents who are very traditional when it comes to mental health issues? She's noticed, she thinks they're showing signs of anxiety, of stress, but there may potentially be a gap of knowledge or understanding. So what advice would you give to Thea? Who would like
That's
to
a
go
very
first?
real, honest question that's, I'm sure, happening. And it's a difficult question to answer too.
Yeah, it's always a difficult question. And then, even if I see a lot of students asking me that question, I am still taken aback. I still find it difficult to explain to them because they have different scenarios. So I usually tell them what their understanding is of their own emotion. How will they explain what's happening to them without talking about mental health, if that is the phrase that the parents actually reject? So I advise them to, exactly how will you describe to me your situation? Will you be able to describe that situation to your parents, that you are feeling this and that? Of course, they will say, yeah, but sasabihin lang naman ng mom ko, wala yan, nung bata kami. I was younger. We just had to pull through, and that's nothing.
O kaya ikain mo, itulog mo, idasal mo.
Yeah. And then we kind of like tell them that, parents sometimes, maybe it's not that they reject what your situation is. Maybe they are finding it difficult also to accept that these things are happening to you. Because they probably are feeling guilty also. What did I do to make my child feel this way?
Actually, the question is, the parents are the one stressed.
Yeah.
So the child is, that's the question, right?
Yes. How do I talk to my parents? She thinks that her parents are showing signs of anxiety and stress.
It's the parents who are anxious and
I
not
believe
open
that.
to mental health
I
concerns.
will keep my mouth shut muna. Kayo muna yung sumagot. Because I misunderstood the question in my passion to answer. Sorry.
Wait. So the parent, okay, I
The
just want to
parents-
verify. I don't want to,
I'm a parent kasi.
Yeah, so the parents are aware.
They're not aware.
They're
but
not
they're
aware.
experiencing anxiety and stress.
And
And they're not open to it.
they're not open. Okay, so it's the parents with the
Correct.
problem. Not,
Correct.
oh man.
I'm not a parent, so
Well,
Wow. Okay.
it's difficult.
How do we do this? First, I'm going to ask the age. That's what I would ask. What is the age group? I know you can't answer me now, but that would be a big part.
They're very traditional, so that would make it older.
Oh, Lord.
Yeah, that's a tough one, eh?
Yeah, that's a
Tough one.
tough one. Well, I have a personal experience. When I was having menopause, I was really, I was crazy, you know. I was moody. I was, and my, and all. If you are a resident trained in psychiatry, you have your own psychiatrist. You know, first year namin psychiatry, they will already tell you if you develop a psychiatric disorder, who is your psychiatrist? Then we identify. And I had to consult my own psychiatrist because I was very moody. And the way that my kids told me that something was wrong with me when I did not notice, because I thought I was a, you know, mental health professional, is that they told me that exact thing, that you have changed. Ma, well, they don't call me ma. Ina is my. You know, Ina, parang iba ka na. Or Ina, mainit ang ulo mo. They just had to tell the behavior.
I agree. I think as the most unqualified person on this stage, my advice would be maybe that parents are actually probably more, they care more about the opinions of their children than the children realize.
Yeah.
Right. I know, Miguel, you're a parent.
I think I have an answer, but it's more of a question to whoever asked this question. Your parents have like a system of beliefs about life, you know, their perspective of reality. I think the question is, because if you're going to introduce this new radical concept that they've never had before, you're kind of like shattering their fundamental understanding of reality and how they operate in themselves, you know, as themselves. The question is, can your parents handle that change? Okay, because if they can't, you're going to have to work within what they know, right? If the parents rely on prayer as a form of meditation to ground them, although they don't understand the theory behind it, but as a consequence, it grounds them, and they don't have the ability to accept this new information into their current understanding of reality, then you have to operate within those bounds. Now, if they seem to have the energy and the willingness to learn, to basically, quote unquote, shatter or upgrade or add on to their understanding of reality, then go for it. So it's basically the assessment, it's the child determining, kaya pa ba ni mama to understand this? You know, can her BP and you know, can her blood pressure and all other issues handle this revelation or not? Because if the child determines that the parents still have the energy and at least the energy and the willingness to do it, then it's worth investing into that. But if the child determines that, you know, they're at a point where change is very, very painful for them, maybe now's not the time. So that would be my question. I don't obviously have an answer. I am not that child, so.
Yeah. That was a very difficult question. This one might be even more difficult to answer. This actually also comes from Thea. So what advice would you give to someone whose anxiety or depression triggers actually come from their family? And they're living with their family, they live at home with their family, it's COVID, they're not of age to, you know, get a job and run away or anything like that. What advice would you have for them?
Alam mo, easier said than done lagi yung advice. But the first thing that we always ask is, you know, how is their physical health? Just please keep yourself healthy, okay? So we first talk about how they can actually maintain a healthy lifestyle, because sometimes it's already, the physical health is already affected by the mental health. And when they feel better, then they have more clarity, and then they can actually deal with all the mental health issues. But we also make them realize that there are chronic stresses that they cannot control. You cannot choose your family member. You cannot control that. So what is within your control? What is within your control is your physical health first, and then your mental health, of course. But if it is affected, then we have to teach them some exercises on how to filter the stressful situations.
You could just also be honest and say, Dad, Mom, Tay, Nay, Ma, Pa, I'm stressed because You're triggering me, and this is how I am. I know there are a lot of family dynamics this is not acceptable. You just have to say yes to respect your elders. But if you're honest, genuine, and you just want to let them know that you are being affected, then that might help. Although it's easier said than done because of our upbringing, probably. But it's still always nice to be honest and say, you need to give specific examples why you are having anxiety and depression because of your family.
Hello. I can't deviate from that answer. It's pretty straightforward. You just have to find out what you can control.
Perfect, because we have 5 minutes left.
There you go. I can't do anything.
Okay, so
same answer.
I'd like to now actually take the time to open questions from the floor. So here, any of the delegates here today, if anyone has a question, we probably have time for one. So would anyone like to ask a question? No questions from the floor? Okay, cool. We got a couple left. Okay, this one will probably take a little longer to answer. So we've looked at the current situation, we've looked at the previous situation, we've gone into the nuances of medication, therapy, the price, economics, culture, all of these contributing factors to the stigma. We've looked at a few granular, particular, extremely challenging cases. I think you guys have all done very well in answering. I'd like the closing question now for you guys to answer. Do you believe there will be a time when mental health is perceived in society at the same level as any other ailment, for example, any physical ailments? Do you believe we can get there? If yes, what is it going to take to get there? Interpret it how you will. Who wants to go first?
Yes, I want to be hopeful that it's possible, hopefully in our lifetime. This summit is a starting point to reach that time. We are in the now when it comes to acceptance in our society when we look at mental health, right, and disorders. And hopefully it's just as easy to go to a psychologist, psychiatrist, or any mental health worker. But we need to solve a lot of things like accessibility and price point. But the awareness is there. The pandemic did a lot of unfortunate things, but one somehow good thing is the awareness on mental health. And there's no need to hard sell the profession or even going to a psychologist or psychiatrist. So we are already living the moment, the start, and we just need to have honest conversations like these.
Yes, I am hopeful. I am positive. There will be that time. It's just like what happened to HIV/AIDS. There was a time when, it was so difficult to come out into the open if you have HIV. There was also a time when you had tuberculosis. I'm revealing my age now. You had to be confined to Quezon Institute, and then even those passing by will just cover their mouth and their nose because they think that they'll get infected with tuberculosis. There was also a time, and even in the biblical times, leprosy was something that was, that was really stigmatized. So I am hopeful. It's going to come. Not in my lifetime, but maybe not in my lifetime, but at least in my children's lifetime.
I'm absolutely positive it's going to happen. It's already happening now. One, of course, goes back to incentives, but the major entity that will really push this would be the private sector, right? And we're doing it right now, like I said, once we're able to prove that there's a return of investment consistently, like across the years of investing in mental health, it's going to escalate, starting from the private sector until government agencies will have to pay attention.
So you think the economy will be a driving force to that change? The decision maker, ultimately, they want the return.
If the government really wanted to just make it happen. They could just easily say, hey, mental health is, that tax deductible. And basically every organization is going to suddenly want to have a mental health policy and mental health services. I mean, it is the private sector that will take that tactical risk to really get the most out of it. And then things will follow forward from the government, from everything else.
Yeah, and I agree, Dr. You cited examples of HIV/AIDS, tuberculosis. Miguel, I totally understand that. Similar to cases like female participation in the workforce 20, 25 years ago, you look at a country like Japan, the Womenomics program there, getting women into the workforce, massively increased their GDP. So maybe it's a case of demonstrating the economic benefit of was, I guess, started as an advocacy. Would that be an accurate summary? Would you say?
No.
No?
I'm fine.
Oh, no, I said, would that be an accurate summary?
Yeah.
Ah, okay.
I thought you wanted me to add.
Oh, no. Forcing you to speak more. No, I wouldn't. Okay, we've gone 1 minute over time. So I just want to say a huge thank you again to Miguel, Dr. Dinah, and Miss Rhea. My name is Michael. Thank you all so much for listening for the last 35, 40 minutes. And yeah, this was a really fruitful discussion. I look forward to having another one next year. And yeah, thank you guys so much for sharing your thoughts and your time.
Thank you, Michael.
Thank you.
Thank you to all of our panelists for that wonderful and insightful panel discussion. Our next speaker is a registered psychologist and certified specialist in clinical psychology. She is also the head sports psychologist of the Sports Psychology Unit at the Philippine Sports Commission. For today's summit, she will be tackling psychology and sports through a video. Let's give it up for Dr. Karen Trinidad.
Okay, good afternoon, everyone. So we're going to talk about psychology and sports. When we talk about psychology and sports, we first define what is sports. Sports is already considered a science. It's a relatively young discipline, especially here in the Philippines, as it is considered as science. But with the first world country, they consider it already as science. So when we talk about science, it is a multidisciplinary subject which calls on things like physiology, biomechanics. So physiology and biomechanics are to measure what is happening to the sports person's body. When you talk about psychology, is to analyze the role of the mind in performance. When we talk about nutrition, this helps fuel the bodies correctly. So they already found the formula for performance. They say that it is 1/3 physical preparation, 1/3 technical skills, and 1/3 is the psychological readiness. But among the three, the most neglected is the psychological readiness. If we're going to look at the different attributes for physical, we have strength, speed, stamina. And then for technical attributes, we have balance, eye-hand coordination, orientation, reaction time, and fluid movements. Now, when we talk about psychological attributes, these are confidence, concentration, consistency, and control. I'm sure you're going to agree with me that neglecting the psychological attributes would greatly affect the physical and the technical as well. So it is very important that we should also consider the psychological preparation in terms of performance for athletes. What are some manifestation or characteristics that psychological is the one that is missing? Usually, the athlete would choke under pressure, they lack motivation, they freeze, they become distracted, and they play without confidence. as we can see that with other athletes as they play. So studies show that within a group of athletes of equal ability, those who receive mental training outperform those who don't almost every time. So what are we saying here? That mental skills, like physical skills, need constant practice. So sports is more than a contest of physical ability. Actually, even before, the ancient Greeks knew that sports also test courage, which comes from the Latin word meaning heart. So I'm going to share with you two books that will contribute to psychological in nature, how psychology is very important in sports. The first book is Talent is Never Enough by Dr. John C. Maxwell. According to him, he insisted that the choices people make, not merely the skills they inherit, propel them to greatness. According to him, it is what you add to your talent that add or make the greatest difference. So in his book, he told us that belief lifts your talent, initiative activates your talent, focus directs your talent, preparation positions your talent, practice sharpens your talent, perseverance sustains your talent, and character will always protect your talent. So if we're going to zoom in more, according to Dr. Maxwell, believe if you want to become your best, you need to believe you're the best. Initiative and responsibility are inseparable. So that's why people who are responsible, they also have the initiative. Focus, direct, and has the potential to take you far. Preparation positions people correctly, and it's often the separation between winning and losing. Practice, develop the discipline to do it a little bit more. Then he talked about perseverance. It's an issue of time. Okay, so it's about finishing. And then the last is the character. So according to him, it will always protect your talent. But character is a choice. During adversity or trials, it is very important that you do the right thing. You take control of the situation as well as your life. So if you're going to look at the different attributes, we have belief, initiative, focus, preparation, practice, perseverance, and character. They all fall down under the psychological in nature. Another book is The Outliers by Malcolm Gladwell. So in this book means something out of the norm. So for Gladwell, he insisted that 10,000 hours of practice is how long it takes to become an expert. So according to him, you have to make the most opportunities and act upon it. Otherwise, something great may never happen. So whatever experiences or opportunity come your way, you should grab it because it will enhance your skills. So according to this book, performance or it promotes hard work and persistence. However, of course, it doesn't aim to say that it is all that is required. So experts believe, and it has been proved, that talent and ability can only take you to a certain level in sports. In fact, after you cross a certain threshold of performance, a talent becomes almost useless, no? Because it's a virtue, it possesses or it brings pride, okay, compliance, and then worse, ignorance to the person. So according to studies, it is only the hardworking and the most stable minds with only a spark of talent who rule in sports. So what is sports psychology then? It is the study of how individuals think, act, and feel when participating in sports. So it is a study of how usually athletes and coaches would think, okay, how do they act and how do they feel when they are preparing for competition, during competition, and after competition. Sports psychology is also known as science of success because it studies what successful people do. In sports psychology, we always emphasize what makes an I. So of course, as we know, the individual is comprised of internal forces as well as the external forces. So what makes an I, we start with the internal aspect. We have the physical, we have the cognitive, we have the social, we have the moral and spiritual, as well as the emotional. Then when we talk about external aspect, we have the society and culture. So of course, it is very important that we also always consider the physical aspect. So like what I mentioned a while ago, it's about skills, it's about techniques, it's about endurance, it's about conditioning, okay, power and strength, as well as speed. Now, when we talk about emotional aspect, we always have to consider the emotional status, the feeling tones, as well as the personality type of the athlete. Cognitive is about attitude, self-directed and conscious planning, as well as problem solving and decision making. It is very important that we develop their problem solving skills, their decision making, because during competition, it is them who's going to decide. So very important as well is the social aspect. This is the teamwork, the interpersonal relationship with each other. So as we all know in sports, they consider it as their second family. So interpersonal relationship is very important. And then we also include the moral and the spiritual. In sports, we develop values orientation and ethics as well as belief. So one good example of this one is Jeremy Lin. He's a basketball player. According to him, all these people, all these things came into my life and they're all blessings from God. And now that I look back, I realize that these are all his fingerprints all over my story. So what is he saying here is that whatever talent he has, he always attributed. So we consider it that spiritual or moral is very important as we develop the holistic approach in sports. So for the external aspect, we have the society and culture. So of course, consciously or unconsciously, it may affect the expression of sports, which is the family, okay, school, history, as well as media. So why is it important? As we talk about mental health, very important that we consider the psychological aspect of the athlete. So when we talk about mental health, it includes our emotional, our psychological, and social well-being. It is very important that we look at the aspect in terms of what is the emotional status of our athletes, okay, in terms of their social well-being, is it balanced? We go back to what makes an I. So we have to consider the physical, the emotional, the cognitive, the moral, as well as the spiritual aspect. And also considering the external, which is the family, the school, the history, as well as media. When we talk about mental health, of course, it also affects how we think, how we feel, and how we act. So with mental health, it will help us determine how we handle stress, relate to others, and make choices. So it is very important that as we develop our physical strength, we also develop our mental health. Because as we all know, okay, if we don't make time for our wellness, okay, we will be forced to make time for our illness. So very important that as we develop our physical strength, we should also develop, okay, our emotional strength, okay, our cognitive, okay, our emotional, our spiritual. Okay? So very important as also that we make our mental health priority. Thank you. Okay. So there was a study in the Australian elite athletes. It was published in 2014. According to the study, 46.4% of athletes were experiencing symptoms of at least one of the mental health problem assessed. So why is it that athletes, or what are the reasons why athletes are not or afraid? Why are they afraid in terms of talking about mental health? First and foremost, because of the stigma. Because of the stigma arises to it, there's a lack of problem awareness. They don't know that it's a problem. There's a denial of the problem. They are not sure who to ask for help. They are scared of what might happen. They are worried about affecting their ability to play or to train. They believe it won't not help them. Okay. Another reason might be not accessible to them, lack of time, and then there's a difficulty or not willing to express their emotions. So these are the several reasons why people are afraid to talk about mental health. So what are the tips to help our athletes improve their mental health during this pandemic? So it is very important that we'll tell them that to focus on what they can control, or what we say, very important to control the controllables, because if they don't control what they can control, normally their energy will be losing to the things that they cannot control. What else? Second, take it one day at a time, or we tell them to focus on the present. Okay, if the athlete focus on the past, normally they get depressed. When they focus too much of the future, it causes anxiety to them. So take it one day at a time, and they should focus on the present because it is something that they can control. Third, adopt a regular routine or schedule. This will give them a sense of purpose as well as order to their day. Fourth, do things that you enjoy and make you feel good. So very important that you practice self-care during this time. So do the things that you like. Try to learn something new like life skills. Before, when you were training before the pandemic, most of the time was spent to training. But now, you can always schedule in terms of your training, or you do self-care or things that you like to learn because you have more time right now. Another is maintain a good health, of course, to increase resistance to illness. We are still in pandemic, so very important that you take care of your health. So food, eat nutritious food, make sure that you have enough number of hours of sleep or quality sleep, drink plenty of water, and of course, you keep moving or exercise. Even if it is pandemic, it is very important that you stay connected with people whom you value. So we can use our cell phone, our laptop, so that we can communicate with other people. Make sure that you communicate with them on a regular basis. Avoid excessive exposure to news or social media to only a specific time or hour of the day so that you will be productive as well. And then last tip would be humor. Humor is very important, especially for us Filipinos. So humor can be one of our best survival tools. So don't forget to enjoy life and to laugh. So why is mental health important? Not only for athletes, but to us in general. When we are mentally healthy, we enjoy our life, okay? We enjoy the environment, as well as the people in it. We also better cope with difficult times like this pandemic. Okay, so we cope with our personal as well as our professional lives. So why is mental health important? Because it nurture, it can also help us combat in terms of our mental health and prevent problems that sometimes be associated with chronic physical illness. So it is very important that we always take care of our mental health. Thank you. So I'm going to share with you a prayer by a golfer, Arnold Palmer. So usually he would read this before his competition. And his prayer goes something like this. If you think you are beaten, you are. If you think that you dare not, you don't. If you like to win, but you think you can't, it's almost certain you won't. If you think you lose, you've lost. For out of the world you'll find success begins with a fellow's will. It's all in the state of mind. Life battles don't always go to the stronger or faster man, but sooner or later, the man who wins is the man who thinks he can. So, as you can see, this is a very inspirational prayer by golfer Arnold Palmer, especially with the line, "Success begins with the fellow's will. It's all the state of mind." So, another, I usually ask our athletes to read this champion's honor pledge. So, according to this pledge, by my efforts, I will keep my body strong, my mind focused, and my determination unstoppable. I resolve to compete in the present with power, purpose, and passion. I know that every sore muscle and the drop of sweat is an investment in excellence. I strive to be my best, nothing less, and joy will come from my striving. True, pain always comes, but I can endure it. My body wins when when my mind refuses to give in. In defeat, I will reflect and learn. In victory, I will savor the glorious moment. Tomorrow, my effort always begins anew. So, how important is psychology to sports? It is very important. As we can see, with the recent Olympics Tokyo 2020, we got our first gold because we considered as sports as science. So also in the article, okay, from Manila Bulletin, the 11 lessons we should remember from the success of Heidelin Diaz. According to this article, very important that we dare to dream, we focus, discipline, there's perseverance, hard work, love, okay, or self-love, work with good people, love for country, be humble, and faith. So like what I mentioned a while ago, okay, what makes an eye? It should be a holistic approach in terms of us taking care of ourselves and also achieving the best in the sports. Thank you. Thank you.
So now it's about time to know more about MindU's partnership with the Australian government via the Partnerships platform. The grant will assist MindU in achieving its key pillars and objectives to make mental health care accessible and affordable to even the lowest sectors of our society. Give it up for Australian Ambassador, His Excellency, Mr. Stephen Robinson.
I welcome everyone to today's summit as we give attention to mental health. 2021 continues to be challenging for everyone, and circumstances have made it even more important for all of us to stay connected and for those who are able to support those around us. We need to recognise that mental health is not about avoiding or treating mental illness, important though that is. We need to embrace an approach in which we are striving to improve our mental health individually and collectively for ourselves and for our families and through our work. Organisations take a strategic approach to mental health because it provides a framework to promote mental well-being, minimise workplace risks to mental health, support people experiencing mental health issues, and reduce stigma associated with mental health conditions. Organisations that care about good mental health are positive and productive, attract and keep talent, and are generally great places to work. Good mental well-being of people at work is good for everyone, enhancing personal and organisational resilience and success. I'm pleased to be part of today's discussions, which I hope will increase our knowledge and allow us to become more aware of mental health and illness, increase awareness of the way that our behaviour can have a positive or negative impact on mental well-being for others and ourselves, and promote an environment where it is widely accepted that talking about mental health and illness is okay, and individuals feel safe to do so. I'm proud to share an exciting new partnership between the Australian Government and Mind You to support mental wellness among Filipinos. The partnership, through Australia's Business Partnerships platform, will increase the availability of affordable psychological services for low and middle income working adults. The partnership is focused on helping women and members of the LGBTI community to get the support that they need. Mind You's platform works in conjunction with provisional psychologists by supporting them to complete their required hours to reach qualification. Mind You will also develop education and awareness campaigns to reduce the stigma of mental health, such as the event we're at today. This partnership complements Australia's ongoing support to the World Health Organization, UNICEF and UNFPA to deliver essential mental health interventions, support and protection for vulnerable children, adolescents and women in the Philippines via a joint program aptly titled Project Brave, Building COVID-Safe Responses and Voices for Equity. Through Project Brave, WHO, UNICEF and UNFPA are working with the Department of Health and local government units to strengthen mental health and psychosocial support systems and policies, build local delivery capacity, and enhance child protection and gender-based violence systems to prevent and respond to violence, exploitation, abuse and neglect. I wish everyone an informative and productive discussion. Congratulations and mabuhay.
Nice. We would like to thank our sponsors, Araneta City, J. Amado Araneta Foundation, Novotel Hotel and Resorts, FINMA Properties, Security Bank, and Spark Philippines for making the National Mental Health Summit 2021 possible. That said, it's now time to turn it over to one of our sponsors, FINMA Properties. Speaking through a video, let's give it up for FINMA's President and COO, Mr. Rafael B. Felix.
Good morning, ladies and gentlemen. FINMA Properties joins the nation and the world in celebrating the Mental Health Month this October. We are actually one of the first that partnered with Mind You in ensuring mental wellness support to our employees. The culture of Taos Pusong Malasakit at Alaga, our Tamang Gawi and Tamang Gawa programs in FINMA Properties, is reflective of how we take care of our employees holistically. Much more the emphasis on mental health, especially at this time. Because of that, we hope that you all have a fruitful day in this seminar today. And it is our objective with Mind You to help end the stigma in our workplace. Thank you very much. Have a fruitful day.
We've now come to the tail end of the National Mental Health Summit, Mind You's inaugural event. And what better way to end it than on a powerful note with Mind You's Chief Executive Officer himself. Here he is now taking the stage. Let's all welcome Mr. Yuri Marshall.
Thanks, Cristine. Can we give a hand to Cristine? She's done an amazing job today. Thank you so much. Firstly, I'd like to extend my special thanks to our official sponsors, Spark Philippines, J. Amado Araneta Foundation, and the Novotel Hotel here in Araneta City, Manila, for helping us host this event. I would like to add my deep gratitude to our official sponsors, Finma Properties and Security Bank. Thank you all for making the choice to stand behind mental health in the Philippines. This would not have been possible without your support. To all the speakers and delegates, I sincerely honor you and thank you for investing your valuable time and energy to our first National Mental Health Summit. This summit is a significant step towards creating lasting change towards the progress of mental health in the Philippines. The level of participation that we have witnessed today from various levels of government, industry experts, the private sector, and passionate advocates is profoundly inspiring. Most importantly, thank you to everyone who is viewing this event online. The fact that we are all connected today through our common passion for mental health, whether it is in person or virtually, is a testament to the power of cooperation and collaboration. Our country and our people are in dire need of sustainable care and support for their mental well-being and overall livelihood. Now, moving forward, as we continue to make progress as a nation, it is vital for us to raise our level of consciousness and develop new belief systems and values that will help support everyone. And I do mean everyone. This can be achieved through the evolution of our own culture. Practicing positive cultural beliefs and adopting new affirmations, like, for example, it's not about me, it's about we. And also, rising tides lift all boats. We can purposefully take control of our direction and find ourselves in new social environments that are conducive for growth, longevity, and the natural resilience of togetherness. On that specific note, I would like to thank all of the other mental health providers in the Philippines for your service to our people. We need all of your support. In fact, we need to cooperate and unite as an industry in order to break the stigmas and make a historic impact towards a prosperous future. Now is the time for change. Now is the time to act differently. And now is the time to work together. I myself am a suicide survivor, so I personally know the power of mental health and how important it is to help people who are caught in debilitating psychological patterns, and beyond that, to save those who are at the edge of suicide and do not know how to back out of a dark corner. Having experienced this firsthand, my life is dedicated to lifting the importance of mental health to the same level as one cares for their own physical health. This same dedication is shared by all of Mind U's family members, and we envision helping more than 1 million people to overcome stress, anxiety, and depression by 2025. Mind U's commitment to transforming the mental health environment in the Philippines was strengthened with the recent partnership with the Australian government, who will be supporting our initiatives towards key pillars targeted specifically to, number one, reduce the cost of mental health services, making it affordable across several income groups. Number two, to reduce stigmas by developing penetrative education, awareness, and conversational programs. And three, to increase access to preventative psychological care using online technology in order to support more Filipinos across the entire country. Mind You is also proud to be supporting a highly structured internship program that is designed to increase the number of licensed psychologists in the country by providing real-world training to graduate psychologists for their required practicum hours to reach their licensing. This program has given way to an innovative cross-subsidy model that will enable us to provide free or subsidized services to economically vulnerable communities, low to middle income workers, women, and the LGBTQIA+ community. All these initiatives and programs will broaden our services next year with our B2C launch, which will provide nationwide access to support individual Filipinos and the wider community at large. Mind You will also continue to grow its efforts to develop transparent relationships with both federal and local government to encourage technological osmosis with every new partnership. Access and utilization of our technology platform can optimize the monitoring and evaluation of future government mental health programs. This means that it will be possible for government departments to access modern technology and obtain reliable data to help produce accurate reports and to also make better informed decisions. In turn, this will improve the efficacy of government projects to achieve measurable outcomes and potential economic gains. Lastly, Mind You intends to forge sustainable partnerships with behavioral health practitioners in the country and across the region. This intentional focus allows us as a community to evolve our usage of the term mental health towards behavioral health. This may sound like a minor terminology change. However, it is a significant paradigm shift from viewing mental health as a singular area of health to acknowledging that mental health is linked to your physical health and how this combined overall well-being is impacted by your habits, that is your behaviors, and by your environment, especially your social environment. So on that note, behavioral health is the next step for mental health. It is a cultural and professional transition to a holistic and scientific approach that incorporates various aspects of well-being, including biological health, physical movement, nutrition, substance use, sleep, meditation, breathwork, and spirituality, just to name a few. Our ability to educate and empower a nation is all in our hands. We truly believe that by protecting and nurturing our behavioral health and overall well-being, we can not only recover from the economic challenges of the pandemic, but we can actually thrive. We deserve to reach our full potential. We deserve an environment in which our children and even their children can flourish. And we deserve a future in which together we can sustainably support each other and the world around us. Let's all end the stigma. Thank you.
There you have it, everyone. We covered a lot of ground today as we checked in with different sectors and representatives of our society to talk about the mental health landscape of key groups, including the women, the youth, and the economically vulnerable. I hope you find the day insightful and empowering. Now, a couple more things to do. Shortly, you'll see a QR code on the screen, which you can scan on your phones to leave your feedback for the summit. Mind You is also happy to announce that they will be rolling out their mental health care services to the public early next year. If you'd like to be notified when this launches, you can visit mindyou.com.ph/public to leave your contact details or scan the QR code. Finally, Mind You will be holding a free webinar in celebration of Mental Health Awareness Month next week. So visit mindyou.com.ph/mindyou-webinars for more details to register. That was a lot to take in. If you feel you've missed anything, remember to follow Mind You on their social media for updates, news, and announcements. This has been your host, Cristine Reyes, signing off for the National Mental Health Summit 2021. Thank you and good night.